So my findings in the honors program, so they have it in the way. So it's only honors students.
This is just Kristen. Okay.
But there's only 3 weeks on the rest of course.
It's okay. She's
And
not late
let's
yet.
say it's like the honors program is yeah, so he got the same profile. I mean, he likes the way video games and just feel much more comfortable. I'm actually because I think that you could have your child and 3 other people with you. So I can't imagine 8 so they put the roommates in. Kristen, you forgot your stuff. They moved the roommates at the same time. So that's a good question.
Kristen, you look so mobile.
So
You look so mobile.
so we got
Look at this.
A
A little soft shoe for us.
You like that?
Wait till you see the bill. It was really comfortable, actually. It is real.
Hey, did these lights switched on?
They have the solid.
Hello? Hello?
We had to go through some off.
We can go around and just check our mics. I know mine was a little tricky. So, and remember, we have to go back to talking really close to the mics again.
Here.
Hello?
Hello. Test.
Test, test.
Test.
Check.
Test.
Test. Test.
Test. You're gonna want to pull your mics close because Pete, I need a little cord for me to be able to do it. Because what we do is we test it and then when we go to talk, we forget. So we keep it out there. And I think there'll be, we this year, not only are we keeping Zoom, we are putting it on YouTube. So we're kind of doing it 3 different ways.
No, you don't have to courage, right? Because if you're exposed, if you've had the shot, they're not going to make you quarantine. But if you haven't, they have to start to provide. So we did. So you provided those. So they're checking out. You're good. Thank you. I think you're encouraging.
Which I think that's probably a better way to do it.
It's 6:30 and we're going to begin to, but before we begin with the public hearing that we have today, before we begin with the public hearing that we have scheduled for today, we just comment to anyone who is attending via Zoom or listening to pass this information along for those who are trying to connect, that the Zoom link is on the agenda and can be accessed on the SAU website. The link and the passcode is there. There's also information on how to connect by phone on the agenda as well, on the first page of the agenda. Let me just let anyone know who is connecting with us via Zoom that as we know, this can be an on again, off again thing, and we can't guarantee the quality of the audio or video. However, everything is being recorded via CATV and will be available in a couple days. And it will also, the recording, the Zoom recording will be available on YouTube as well. And that link will be available on the website. So we'll begin tonight with a public hearing. I'm opening the public hearing for the proposed $15,000 donation from the Byrne Foundation for the World Story Exchange at Lebanon Middle School. Joanne, could you give us a little detail on that, please?
I'm just looking to see if John's here in person. I know that this is something that has been ongoing. It's used by multiple classrooms, and that the teachers really appreciate this being supported, and it's an integral part of their curriculum. John, did you want to say anything more about the World Story Exchange. I shared that it's been something, my understanding is this has been something that we've done before. It's part of the curriculum. We're very appreciative of the Byrne Foundation support, but I didn't have more details.
Good evening. I'd be happy to. World Story Exchange started under the leadership of Mr. Armstrong. He connected with the organization. The students do a project around our core values, and it's personal to them. And the World Story Exchange folks come to our school and work with our students. He's been successful with it for a couple of years. And now Mrs. Rooney, formerly Miss Corsones, is joining him this year for the project. It's an 8th grade project. 8th graders on both Birch and the Oak team will participate in it. And they're great to watch. We do a movie showing usually, and we send the videos out through the newsletters and stuff. So it's really cool. So I hope, thank you.
Thank you, John. Does anyone from the board have any questions to ask or comments to make during this public hearing?
I've seen the videos they've made in the past, and they are really high quality, and the kids are very interested in the project, and it's a level of engagement that I don't think we see often with this age group. So it's a really good program.
Are there any comments from the public during this hearing? I don't see anyone, only a couple people in the room. Joanne, is there anyone who has their hand raised via Zoom?
Not that I can see.
Okay, that concludes the public hearing, which is now closed. We'll now begin the regular school board meeting with the Pledge of Allegiance. Okay, item 2 on the agenda is moot because Mrs. Began is here. We are going to be having public comment during the meeting this evening. And this is done either by raising your hand here in person or raising your virtual hand on Zoom. And as usual, we ask anyone participating in public comment to state your name, the ward in which you live, and limit your time to 3 minutes. And public comment is governed by policy BEDH. We will be doing our public comment a little differently tonight. There is going to be, I know there's considerable interest in the 5-day in-person back to school plan, as well as the plan for athletics co-curricular and lots of other issues associated with the back to school plan. So what we will do when we get to that item on the agenda, in the interest of efficiency and allowing everyone to participate in a timely manner, the Superintendent Roberts will make her presentation. We will have board discussion, and then we will open up for public comment and before taking any board action. There are a number of topics to be discussed, and so that's going to be sort of a punctuated event where Joanne, I know, is planning on speaking about a couple topics and then stopping for board questions, and then moving on to others, because there are a lot of moving parts here that I know the board has questions about. But then at the end, we will take public comment before doing any motions or any votes. Additions, deletions from the agenda. I know we are going to reorder things somewhat. We're going to move item 9, unfinished business, up to right after item 7. So we're going to exchange item 8 and item 9, so that as soon as we approve the minutes, we'll move right into the unfinished business, which most concerns people. Joanna, are there other additions or deletions from the agenda?
None.
Okay, at this point, I will open public comment for anyone who wants to contribute something to the board that is not concerned with the 5-day back to school plan, masking, athletics, all these sorts of COVID-related things. We'll have separate public comment there. But if anyone has anything that they want to say to the board on some other topic or some other item on the agenda, I'll open public comment now for that.
I have a person online, but is there anyone here? Is there anyone in person that would want to speak first before we go to a hand raised on Zoom? Not seeing anyone? Stephanie?
Okay, can you hear me?
Yes, could you please state
Okay.
your name and ward, please?
Yes, my name is Stephanie Urosevich, and I'm in Ward 2. I have a question which may or may not be answered as part of your equity audit update. I know that's been a lot of discussions around the equity audit and that it was going to be taking place this year. I wasn't sure if there was ever any discussions on how it was going to be funded. I know that had cost a lot of money for the Hanover School District, and I just was wondering how that was kind of being funded when we have so many projects that were unable to be funded.
So in my superintendent's update, I provided a description to the board of the work that I've done since last year. We were informed that the audit was free. Their fee structure completely changed. And we're looking at a cost of $50,000 to $60,000 because they now charge for each infinity group and a summary for each infinity group. I have an interest in, so has our SALT leadership team, because we met and had a momentum meeting of having a survey that's more so crafted for our district, done a lot of research and finding that a national kind of pre-created survey might not give us the information that we're going to spend the time and the energy doing. So I've begun to look at that. I'm looking to see, and I don't know if it's possible, there's a 20% amount of ESSER funding that has to go toward learning. So I'm going to draft language and just see if that's a potential source. And I also have a call into the DOE to see if there's any grants out there that might support this work as well.
Thank you very much. That's very helpful.
Thank you for bringing that up, Stephanie. Is there anyone else waiting, Joanne?
Just take a second because I don't want to miss anyone. I do not see anyone who's doing comment other than the 5-day. And I just repeated that because a whole bunch of people hopped on. So.
Okay. All right, thank you. So we'll close this portion of public comment. And as I mentioned, we'll open it again when we talk about 5-day back to school plan and all the associated issues there. Correspondence, as usual, we have, as we get emails, they are being deposited in a folder on the SAU website among the board documents, and all that correspondence is there. I don't know what the current count is right now. I think last time I looked, there were maybe 10 or 12 documents there. Okay. So we'll now move on to the consent agenda. We'll need a motion for approval of the public minutes from the 9th of June, 2021.
I'll make a motion to approve the public minutes from Wednesday, June 9th, 2021.
Moved by MJ, second.
I'll second.
Second by Lil. Are there any corrections or questions about these minutes? Hearing none, I'll call for a vote. All in favor of accepting the minutes as they have been given to us, raise your hand. Opposed? Unanimous.
I will note that our minute taker, Roger, will not be available to do minute taking. I've reached out to several organizations and haven't found a minute taker. So if somebody happens to be listening who's a professional minute taker, if you could please email me. We would appreciate that support for the next month or so. The CATV recording would be available at the maximum of 2 days. And as I mentioned earlier, we are streaming live on YouTube this year, as well as via Zoom. So those are different places that people can watch the board meeting, and we will try to get those minutes typed up and available at the SAU as soon as possible.
One thing I will note on the our minutes that we just accepted reflect that we went into non-public session at 8:00 p.m. On June 9th, but we don't have any minutes for that non-public session. So that's something that when they are available, we can accept those probably at the next meeting. Although Joanne's scrambling around, it could be that they're here and just didn't make it into the folder.
We're missing a document in the packet. I can pull it up though for resignations. That's what I was mentioning to Tim. So I apologize if I didn't hear what you had said.
No, I was commenting about the absence of minutes for the non-public session that we had last time.
Okay.
That we can get those and act on next meeting. Nominations and resignations, retirement.
I'm not seeing those in this packet. I'm going to have to put those forward at the next board meeting. That's what I was referencing with Tim.
Yeah.
They go from Heidi to Lori. So I don't know where there was a disconnect, and I'm looking at the link and not seeing them. So they must not have gotten uploaded. So I will be certain to be sending an email this evening about that to make sure that doesn't occur again, and I will bring them forward. We have just a few positions that are still open. We have a paraeducator, we have some paraeducator positions open, and there's a special educator position that will be posted at the high school level. So overall, we've attracted really strong candidates and we're doing well. And I will get that information to you as soon as possible.
There's nothing time sensitive requiring board action.
Correct.
Okay. Thank you. All right, as I mentioned, the change to the agenda is we're now going to move down to item number 9, unfinished business. And we'll start with the superintendent presentation on 5-day in-person back to school plan for the fall and related issues. And as I mentioned, this will be somewhat punctuated because there are a number of moving parts, and where it's logical for Joanne to stop and ask for questions, she will do that. And then we'll have public comment at the end of all that. And I know we have people joining us from Concentric, the Concentric Testing Company, and they'll be participating via Zoom as well.
So I hope everybody had a good summer. It feels like we were just here and we're back again. So we're looking forward to a great year here in Lebanon. We're looking forward to opening our doors and having our students come back on September 1st. So there are some specific things I wanted to highlight in this presentation. And the key things to being able to keep our schools open 5 days a week depend on the health of our staff, including the substitutes, the health of our students and families, and the health of the Lebanon community members. When talking about mask use, there's 2 important purposes. One, to protect the person wearing the mask, and the second, to prevent the spread of COVID from the person wearing a mask to others. There are some recommendations that I've sent out several times in emails and letters that when we're determining mask use, there's a recommendation that we look at community transmission, which is reported at the county level. We also, when I send out my notes, I'm sending out Grafton County, I'm looking at Upper Valley. I'm also looking at if there's data Lebanon wise too. So we're getting that whole picture of data based on the number of cases of COVID occurring within the school or child care facility and the presence of clusters or outbreaks. The ability to implement other prevention strategies, for example, physical distancing and cohorting. For example, you can separate children who are indoors by 6 feet, or activities are outdoors. Masks may not be as important. And the level of COVID vaccination data, which is available on the vaccination data dashboard. And I did pull the data and updated the slides yesterday. So the data that we see today is the data available as of yesterday, August 24th. Sorry, it clicked out. Just give me a second and I will hop back into the presentation. The Department of Public and Health Services provided 2 presentations over the summer. And at one of those presentations, they provided this data decision matrix, and it color codes and lets school districts know when DPHS would recommend wearing masks. And so that tends to be on this right-hand side where it's called universal masking, when the rate is substantial. And we will be looking the school year at many different factors when we're determining masking, but this was a tool, and they've stated several times, it's a tool for districts to use to try to make those determinations. And this next slide simply talks about the differences between minimal level, the moderate level, and the substantial level for the matrix. They go together. So there might be interest in where we were as of yesterday. As of August 24th, 76% of individuals in Lebanon are fully vaccinated. Grafton County has 62% of individuals who are vaccinated. And their recommended target is at least 80% of individuals in the county and town. Currently, the community level of transmission in Grafton County and the Upper Valley are both considered to be substantial. In Grafton County, there have been 239 new cases per 100,000 individuals over the last 14 days, and the test positivity rate of in the last 7 days is 2.7%. And in the Upper Valley, there's been 178 new cases per 100,000 individuals over the last 14 days. And the test positivity rate over the last 7 days is 1.3%. Over the summer, I asked if our staff would please voluntarily let our Human Resources Department know if they were fully vaccinated, not vaccinated. And Tim and Xavier worked on this data. So this is the staff vaccinations for Mount Leb, 74%, Hanover Street School, 75%, the middle school, 71%, and the high school, 91%. I'm just going to go through a few more slides and then I'll stop and people can ask questions. So we use a Power School system that parents input data in the beginning of the school year. We have thousands of students and not all parents have filled this information out. So when you look at the data, you have to be a little cautious because not all of the families have entered their data. But at the high school, there's 621 students. So 75 student reports. And of those 66 said yes, they were vaccinated. 8 said they were not, and 1 preferred not to answer. At the middle school, a total of 466, 155 of those families or students specific responded yes, 70 vaccinated, no, 77 vaccinated, prefer not to answer 8, which you would have students that are not able to be vaccinated. So that number kind of correlates. And then at Hanover Street and Mount Lev, there were some students who were able to be vaccinated. So 1 was vaccinated at Hanover Street that responded, and 2 responded at Mount Lev. Before I go on to the next slides, are there any questions the board might have? We also have our principals here this evening, as well as Mike Stone. Stephen?
So on the slide that describes the percent of staff in each school that reported they were vaccinated, what percent of staff reported? How representative is that sample?
Oh, that's a good question. I have so I guess it's the same, because I took the numerator is the number of people who said I'm vaccinated. The denominator is how many people were in that building. So we said respond. You could respond no, but nobody did. So like in Mount Lab, 46 responded unvaccinated, and there's 62 staff. So it comes up to 74.19. It doesn't mean that the other ones aren't vaccinated. I mean, it's good to assume that some aren't, and some may just have not responded on email.
Yeah, I just want to understand the methodology. So anyone that didn't respond was counted as a no?
Correct. Yeah.
Follow-up question to that. Is there going to be any, I mean, now that we're entering start of school, are we going to be doing another ask and actually check off who has responded and who hasn't and follow up with them, just so we have a more accurate picture of the vaccination of the staff and teachers?
We can keep asking. I don't feel that I have an authorization to respond either way, whether we're actually going to ask. I think that you'll see in another slide. I think that that's kind of ongoing. Like,
Could you come close with the microphone? I don't think anyone.
I'm sorry. I said we can keep asking. Actually, as we're working out for a flu vaccine, they're going to bring. We partner with Rite Aid, and so they'll have the COVID vaccine with them too. So that's another opportunity. We'll keep asking. But as far as where they're going to record who's yes and who's no, I'm not. Well, I can't answer that yet, and I think you'll see that in some of the upcoming slides. I mean, we will if when we're told we should or could or can. But we're just data collecting as right now based on what our instructions are in the HR.
Stephen.
Yeah, just to follow up my question. I mean, the reason why I was asking is the methodology that you used, I think, is good, because in a sense, it underestimates the actual number, because some of those that are counted as no may have actually been vaccinated. So our numbers are probably higher than this.
That's right. I'm not a scientist, but that's what we were thinking. I'm like, I don't want to count someone as a yes if I'm not sure. So if we're not sure, they're a no for the purposes of this.
So this is sort of representing a worst case scenario. The numbers are actually probably better, but we don't know.
Before we leave this particular subtopic, just further to Christian's question, you don't know who's responding, do you? I mean, are these anonymous responses or they're by individual?
They're by employee.
Okay, so
Right.
you do know, and you can follow up as was suggested.
Yes.
Okay,
Yeah.
thanks.
I could theoretically, I can easily go to the employee list to see who's responded. I have other data points. For example, I had to put the list of employees together for the vaccine clinic that we had back in March. So there's things we could do, but we're going to do what we're allowed to do and what's right and ethical and legal. And until then, we'll just go with what the voluntary stuff is. I hope you understand that.
Will,
I have a question about the, something you said, Joanne, when you were talking about the DPHS decision matrix slide. And you mentioned that there will be other factors that we'll be using to determine masking throughout the year besides the matrix. Can you tell me what those other factors would be?
Well, I think over what I was trying to say is that it's a cumulative picture. It's not just the county data, and people were hopping on the county data. And I wanted to emphasize, and people, stakeholders had written me to make sure that it just wasn't that point, that we'd be looking at Upper Valley, that we'd be looking at Lebanon, that we would be looking at number of students or staff who are testing positive. And thanks for asking that so I could clarify, but it's just more than one data point that I think we should look at.
Thank you.
are there other questions on what Joanne's presented so far?
And this is for the board at this point. So if people are watching via Zoom, we'll circle back around to those questions at the end of the presentation.
Yep. Okay, proceed.
So, there's some questions about, can a school district require staff and students vaccinations? So I spoke with the UNICEF rep, Karen Ladd, just yesterday, and there is agreement from any, sorry, did I? There is agreement from NEA NH to encourage individuals to be vaccinated. And what that means is that if a school district were to have conversations with the union, the NEA NH would not oppose those conversations. And so I have been in contact just to kind of get a sense of where our union presidents might be on this. We've sought legal guidance and the conversations will continue. There are some concerns about going along this route. One of them is if a school, so they did a sweeping New Hampshire, we support vaccinations, but it's up to the local district to start those conversations, and it's up to the local unions to decide to participate in those negotiations, conversations, and there would be impact bargaining. And impact bargaining is a conversation, it's a dialogue saying that the union says to the school board, if you want us to do this, then you need to do X, Y, and Z. So we've all been through negotiations. It's a kind of memorandum of agreement, memorandum of understanding, bargaining impact. In our district, we have 4 unions. We have the administrative group, the Secretaries Association, the LEA, and the LSS. So we would potentially be in back bargaining with 4 different unions. And there's also feedback that some people might decide to leave the district, and there's concern because we do have openings as it is. If we have people who decide to leave the district because they're either electing not to be vaccinated, and we have to be cautious because if there's a health condition or a religious reason, then you can't mandate the vaccine. That is something that school districts are really considering because we need every single person that we have. We really value everybody. And something to look at is where each school district is as far as their staff who are vaccinated versus just doing a blanket mandate for vaccinations. So I've been keeping track of this for a couple of months now. I've been contacting people, trying to get an understanding to be able to explain it to folks. And there were several board members who asked me about staff vaccinations. So I wanted to add it into the slide. And students, we cannot at this point mandate student vaccinations. We encourage vaccinations. We are hopeful that there'll be a vaccination for 12 and younger coming out late fall, early winter. We know that Pfizer has now been FDA approved for adult use of that vaccine. So there's just a lot that's changing every day. But I wanted to put this slide together with the most recent information I have and do my best to explain it to the board. The language about this topic I've heard is murky at best. And I've heard that from our legal counsel as well as NEA and NH. So it's a lot of interpretations out there, and I just wanted to put that information out. So I would like to hop into what a day might look like when our students enter our school on September 1st. So per Governor Sununu's order last April, the plan is to have all students and staff in school 5 days per week. And I write for as long as we can offer this model, with the hope that we'll be able to offer this model continuously throughout the school year. Just like last year, we're walking into many unknowns. We are having all SAU 88 employees and students, also visitors, are required to wear masks in school facilities. But our meetings with parents and visitors, we're first going to try to hold them virtually. And if a meeting must be held in person, the parent and visitors must wear a mask and also physically distance. So the start of the school day. So based on recommendations, we will not have staff and parents complete the daily health screening tool. It wasn't found that that was very effective. What was most effective was if a staff member who knew the student well noticed that the student might have symptoms, and or the nurse, and bring the student to the nurse. That worked out the best. And we're going to continue to emphasize for fall 2021 that if a staff member or student is not feeling well or has COVID signs or symptoms, they should remain home and do not come to school. Anyone with symptoms should contact their family physician to receive guidance about self-monitoring and COVID-19 testing. And we really encourage parents to get out in front of this. If your child has previously diagnosed allergies, the nurse's office should be provided with a doctor's note to that effect for the health record. As far as the daily schedule, we will continue to meet the number of hours required for the DOE. And we're planning to keep our regular, so pre-pandemic 5-day in-person schedule. So that would be the high school, 7:30 to 2:35, with 7th period ending at 2:06. The middle school starts 7:22 with the drop off, 7:30 advisory starts, and 2:25 bus dismissal, and then a 2:30 to 2:40, the car loop and the walkers. Hanover Street School, 7:50 a.m. drop off, 8 o'clock start. The school day ends at 3. Mount Leb will run the same schedule, 7:50 drop off, 8 o'clock start. School day ends at 3. And we are not going all the way back to really early student drop off. We wouldn't be able to maintain the cohorting. So the early drop off is considered to be 7:50 a.m. for Hanover Street and Mount Leb. We are planning to maximize our physical distancing, and we do have 3 or more feet of distance between students, and we can manage 6 feet of distance between staff wherever possible. And we're going to try to physically distance as much as we can. So if we have 4.5 feet, we're going to go 4.5 feet. We have 6, we will go to 6, but we do at least have a minimum of 3. When eating, staff and students will maximize physical distancing between individuals. So we have worked this out with the principals as far as their schedules and places where students can be, that we are maximizing that distances. At the high school, they are spreading the students out, and actually there's a couple other classrooms they're going to use to make sure that there's that additional physical distancing. Outside tents will be set up by the first day of school, September 1st. And we are going to maintain physical distancing between people in situations where there may be increased risk of respiratory aerosol production. So we're looking at 8 to 10 feet of physical separation between people during group activities that involve forced and heavy breathing indoors, like a fitness class, singing, wind instruments, and alternatively, this is where they say we can consider face mask use for people engaged in higher risk if indoors, and we're going in with universal masking. As far as cohorts, we're considering having our youngest children who cannot be vaccinated by the start of school to remain in the cohorts as fast as we can. And this guidance was also for childcare facilities, but if we can put these mitigating layers in place, we're going to. So we're going to do that. The middle school and high school students will follow their course schedules, We're going to keep assigned seating in case we're asked to perform contact tracing. And based on the guidance, if a staff member or student tests positive, unlike last year where we had the younger students and the whole class was quarantined, they are not going to be asking the entire class to quarantine. Each person who may have come in contact with the individual will be asked to self-monitor, and if they do not feel well or have symptoms of COVID, they should remain home and contact their physician.
Yeah.
Sure, MJ?
Yeah.
So with that, it sounds like, are you still doing then the contact tracing and the parent will still get a phone call that their child was possibly exposed in the class so that they know to monitor their child?
We think so. The cases that we've had so far that I've communicated out to our community were not such that we had to do huge amounts of contact tracing. For whatever we've learned last year, we kind of have to switch. And unfortunately, we're going to have to experience it and find out what that means. But I would think if it was a classroom situation, we would definitely be saying there's a, making this up, a third grade student who's tested positive. The parents of that class have been notified, because I think that's essential, is letting people know what's going on in our schools, because that also continues outside of our schools. That's play dates, that's birthday parties, that's all those things that happen. So I intend to continue to push out information, and the principals would be contacting parents if it was in a particular class to alert them, because we want people to be looking for those symptoms. So support for social, emotional, mental health. So support from administrators, teachers, paraeducators, our psychologists, behavior specialists, student assistant providers, student support providers, counselors, and nurses. We're fortunate that in Lebanon, we have these positions, but also fantastic people who are in these positions. And we know that students do best when they have at least one contact person, if not multiple, within a school. We also have brought in additional support for Mount Leb, Hanover Street, and the middle school. We have additional support from counseling associates to come in to work with individuals or small groups. And the high school is working with West Central to do the same. And we started those conversations last spring to make sure that they would be in place for the school year. And we wholeheartedly want students and families to contact us if they have any questions, concerns, need for support. We're here to help, so please reach out to us. And as far as pick up and drop off, we might have parents who prefer to pick up and drop off their children rather than having them ride the bus. For pre-K through 8, we'll continue to use Pick My Kid app, which has been very helpful in the drop off and pickup process this year. We are also going to continue with assigned seats, just as MJ mentioned. If you have a positive case, we want to be able to say on such and such a bus or this area in the on the bus. All passengers are required to wear a mask on buses. And I just mentioned about Pick My Kid and assigned seats. So last year we started with snow days fully remote. And then in January, I think it was, I asked if we could have traditional snow days. And unfortunately, it never hit. So they didn't have a traditional snow day. I would like to start off with traditional snow days. So no school, no remote. But then if we're getting to a point where we have a lot of full snow days, maybe we go back to remote learning. So we're not adding days to the end of the school year. And I would come to the board and we'd have a conversation about what that might look like. On to athletics and co-curricular activities.
Should we pause for questions?
Oh, sure. Are there questions about the school day from board members? I tried to describe it as best as I could.
Stephen.
So I guess I'm not quite clear. Last year, if a student in a classroom tested positive, those who were deemed contact, so within a certain number of feet for more than 10 minutes, were notified and they had to isolate. They had to quarantine. Right? We're not doing that anymore.
That's not the recommendation.
In the context of a much more contagious virus.
The recommendation from DPHS is not to quarantine. if we were to call them, they would say, everything's a local school decision. But their recommendation is not to quarantine the whole class, but to have people monitor for symptoms. That's their recommendation.
Right. I'm not suggesting the whole class. I'm suggesting those that were deemed contacts. I mean, last year there was a very strict definition of who was a contact.
Yes, we don't have that strict definition. If the board wants to put something like that forward, I think that's doable for us because we have assigned seats. But parents might push back because it's a recommendation that their child be in school still. And if the school board says, we're going to ask you to, quarantine or isolate, but it doesn't agree with DPHS, the board just has to be aware that you're asking me to go to a level that's not recommended currently by the state.
Right, but it's still our task to ensure the safety of our kids. Right?
It's a local board decision.
Right.
Yep.
I have a question.
No.
We've said several times in here that if a child is symptomatic, that we recommend that they contact their family physician and get tested. Would it be possible for them to get tested via concentric if we're having testing happening in the class in the school district already?
Well, if they have symptoms, then they shouldn't be coming to school, and concentric comes into the school.
So yeah, that makes sense.
They are here, and after this next section, they can answer that question. But my understanding is they are voluntary testing those who are in the building, but it's a great question.
Just because there is a matrix for what happens if a student presents with symptoms in the building, which we know has also happened before. So I was just wondering about that.
Sure. So that's a great lead on to this next section. So Ian and Mike have an opportunity to talk more fully about this, but we have put plans in place in regard to our athletic and co-curricular activities, and we will hopefully have board support to continue those activities as long as the board deems that that's safe. And if things change, what we're agreeing to this evening might change. It's a very fluid situation throughout the school year. One of the mitigating layers that I looked into last spring and over the summer was voluntary COVID testing for staff and students. And it's important that this is voluntary. And we can be partnering with a COVID-12 testing vendor, Concentric by Ginkgo Bioworks, and they provide end-to-end testing services in partnership with DHHS. They are an approved vendor. Optional asymptomatic screening testing can identify positive cases in our schools and generate important information on the prevalence level of the virus in the school community, such that action can be taken to slow the spread. By implementing an optional testing program, we can help prevent outbreaks and keep students safely in person and on the athletics fields and also in our co-curricular. A pooled or cohort testing methodology, which Concentric runs, allows for testing of an entire classroom, sports team, or extracurricular group at once in a single sample without collecting any personal information from test takers. And it takes about 10 to 15 minutes to actually test the classroom. Then the test kits get picked up by a courier service and they are brought out to a location in Boston. And then I know that Ben Rome is online and give more information. We had a meeting with Concentric and our nurses and principals yesterday. So we're kind of learning how this will all work together. And there's a quick turnaround there. And he can describe what happens if there's a positive case in that pooled group. And what was really important was that the testing and the staffing is provided by Concentric, and it's also fully funded by the federal government. So last night and this morning, I went in and I set up into their system our 4 schools as 4 different organizations. When we ask parents to fill out a form digitally or in paper, they get an ID code, and that allows the system to say, okay, this is Joanne Roberts, she's at the middle school, and my name would appear at the middle school. So that part of the data process is not on us to do, it's through them. And And then they do supply all the nursing staff. The only people who have access to the data is myself, the principal, and the school nurse for each building. And we will, when and if there's a positive case, we'll be working with Concentric. We'll be working with the Department of Human Services, and we will have our plan in place about how we communicate all of that to parents. There's a potential of false positives, and so we just have to be cautious that we are upfront about the potential of false positives so that we're not increasing people's stress, but that by doing this, it's another layer to try to keep our communities safe. Okay.
Now, I know there are questions about this.
Sure. Why don't I stop there? And let me try to. So if the board has questions, Ben Rome is here. Ben, can you hear us?
Yeah, I can. And hi, everyone. Thanks for having me here tonight.
Thank you for joining us. So there may be board questions directed to you. If you could just kind of provide a little bit of your background and your role in Concentric, that would be terrific.
Yeah, absolutely. So yeah, I'm Ben Rome. I'm a director at Concentric by Ginkgo Bioworks. I oversee all of our K through 12 COVID testing programs across the Northeastern United States. So that's New England plus New York and New Jersey. We currently do, in the Northeast, we currently have statewide programs kind of similar to New Hampshire in both Maine and Massachusetts. So I work both directly with New Hampshire HHS on the program as the point person from Concentric, as well as with the districts in rolling out the program. So yeah, happy to take questions. I don't know, Joanne, if it's helpful, I can give kind of like the brief overview of what the testing looks like, or if you think folks kind of have that, we can just go into questions.
MJ.
I got lots of questions, but
Pull
so
the microphone as close as you can, please.
Yeah. So I guess my first thing actually is Joanne touched on that there is a potential of false positive. So what is your false positive rate on the asymptomatic individuals?
Yeah, great question. So the pooled test is a PCR test. PCR tests have a very low false positive rate. They're highly sensitive and highly specific, meaning if it's COVID positive, I think it's 99.5% specific. So in 99.5% of instances, it was a true positive.
Okay, continue.
No, keep going, MJ.
Okay, so what happens if a child, the parent consents for it, but what's your protocol if when you get in the classroom, especially in the younger grades, the child decides that they don't want to do the test or perform? I can see, a kindergartner or first grader, their mom says, yeah, you can go have the test. And then when the day actually comes, the child refuses to do the test. What are your protocols for that?
Yeah, absolutely. Great question. So we obviously are not going to force anyone to do the test, regardless of whether they've consented or not. So if a child doesn't want to do the test, our nurses are certainly not going to force that upon them. What I will say is we've had the chance through last school year to test at over 1,000 schools and at different places across the country. So one of the things that we have been able to do is help develop a lot of materials, both for parents and for kids, that the district and schools can provide in advance of testing to kind of familiarize them with the process. The other thing, just to add, is actually generally we've found that the younger kids are more often kind of more excited to do it. It's a lot of the classes kind of make up different phrases like, if you can pick your nose, you can swab your nose, things like that. And so that has not been a huge issue to date. Not saying it couldn't happen, but it hasn't come up frequently.
And I guess another question, what is the frequency of the testing that you do? And is it a blanket consent for the entire year, or can a parent revoke consent at some point during the year?
Yeah, absolutely. So I'll touch on the second point. So the consent is it's a blanket consent, but it can be revoked or taken back at any time. So you only need to consent once, for the whole school year. But if at any time a parent decides they no longer want to participate, they can of course revoke that consent. And then in terms of frequency, your other question, I'll actually put that to Joanne. It's ultimately up to the district to determine frequency. We give the tools and the tests and the support, but ultimately leave that to the district to decide.
Based on our conversation yesterday with administrators and nurses, and the fact that over 50% of the schools that you worked with are weekly, we were moving toward doing a weekly test.
Yeah. So what I can say is, most commonly we see weekly. So we're working with Manchester right now, who I know is starting the onboarding process. Their plan, at least as it stands, is to do weekly. I'd say most of the places, like a little over half, do weekly, and then some do every other week, or some do less frequently.
So Joanne, does that mean that weekly, like all the different groups are being tested weekly, or we're doing random tests weekly?
That's so what we learned yesterday is that you can do up to a group of 25, and our classes aren't that big, so we're comfortable doing a class. And then we let them know the number of classes we want to do each day. And they can do multiple classes, multiple grades. And we are trying to set ours up for Monday and Tuesdays, because that way we get the results back on like a Wednesday or Thursday. So when I put it into the system, and I asked the principals for our leadership team meeting tomorrow to let me know how many pools that they're going to have. And then Concentric provides the staffing to be able to do however we want to do our testing. So it'd be once a week, and we might have, like the middle school and high school talked about having their advisories being done. And they'll let me know tomorrow if they think they can do all their advisories, or if they're going to do half their advisory on a Monday and half on a Tuesday. But I'm trying, and then I have to determine with the leadership team the number of kits we need to get. The kits are sent, they're ordered, and then what the staff does is when they leave the kits at the front office for the courier to then come pick up and drive out.
So are we also doing it with athletic teams, or?
Yes.
We would be?
What we talked about is if we could actually start with our traveling athletic teams, because there's a smaller number of those, we could get those up and running sooner, and potentially start that September 6th if parents give us the forms back. And then we're looking at potentially starting this district-wide September, like the week of September 13th or so. It just depends on onboarding and how long that takes. But we had the meeting yesterday morning, and I was on the system last night and today inputting the information to try to keep this moving as quickly as I can.
Go ahead, MJ.
Just one more, and it kind of touches on Stephen's previous point. So now we have the pool test and someone turns up positive in the pool. What is our protocol as a district for that class of 20 that we know now that one of the 20 at least is positive? Are we going to quarantine that whole class until everybody can get retested, or are we just going to let everything go along as is until everybody gets retested and we find who that positive student is?
The DPHS would recommend self-monitoring. The board could do something more. I mean, you're going to get the same answer because it's the same answer. It's a local decision. DPHS is not going to step in and say that's too tight. What I will say though is last year, and the principals know this, when we had positive cases, I had to write a waiver to the governor every time there was a positive case. Yes. And one time there was pushback about a decision we made that DPHS was involved in. Now I'm working with the DOE, that's not a health agency. And I had frequent emails back and forth, included the commissioner on it, and said, we're going to follow this. You know, how can you disagree with the recommendations to not have certain students in school because you're putting forward a 5-day in-school plan? And that's why I'm cautious about what I say, that this is a health matter that we all know is a political matter that is a matter in education. So if you picture a Venn diagram of all of those circles, the most important one is the safety of our students. And as superintendent, I'm just trying to put in every mitigating factor that DPHS has recommended, and also not just recommending, but mandating masks, and not just saying, oh, we could do voluntary testing, but we're connected with a company. We're going to move forward with whatever we can do. Last spring, when people are talking about the school coming back, not wearing masks, I was here last May saying we should plan on coming back where we are today, because it's easier to take away a layer than add layers on. And that's just very much kind of how I want to approach this, is from that dynamic and a strong administrative team and a great staff. And if the board decides to put in additional mandates, because there would be mandates, we will follow what the board has to say. Other questions for Ben?
I guess what I struggle with here then, and this is not so much a Ben question as a Lebanon question. I mean, if this data is non-actionable, in other words, if we, as MJ just articulated, we come up with, say, there's evidence of a COVID infection in the classroom and it's non-actionable, what benefit, I mean, besides generating data that we can look at and say, okay, it looks like it's sort of in the same realm as what the citywide or Upper Valley-wide infection rate is, or vaccination rate, or whatever other indicator you want to look at. I'm wondering what the benefit of this truly is, day in, day out, or week in, week out. If we don't do anything with this, and maybe Ben can address this. I mean, what are other districts? What are they planning to do with this data? I mean, if our guidance here in New Hampshire is to accumulate this data, look at it, and then don't do anything with it in terms of acting, if we know there's evidence of infection in the classroom, then what are people doing with this?
Yeah, and just to great question, and just to clarify, what does happen is, and Joanne, correct me if your plan is otherwise, but generally what does happen, right, is after when there is a positive pool identified, which just for a reference point, over the last school year across countrywide, we saw a pool positivity rate of a little less than 1%. So like 1 in 100, 1 in 150 pools coming back positive. Obviously, we don't know what that'll look like this fall. But when there is a positive pool, we then do an individual test for each person in that pool. So you then are able to identify who in that pool is positive. The rationale, there's a few different kind of rationales for the pool testing, but basically it allows you to test a large number of people much more efficiently and much more quickly. And then where you do have the positive pools, right, that's where you go and do the diagnostic test, which is just a little bit more time intensive, as opposed to doing that with everyone in school.
Stephen.
So is the blanket consent for the pooled test apply to then having to pursue an individualized test thereafter?
That's right. So the consent covers both the pooled test and the individual test.
And then, so if the individual tests positive but has no symptoms, I mean, our algorithm that says someone has to stay home is the presence of symptoms. So if someone tests positive but they have no symptoms, are we saying that they have to be at home?
Yes, yeah, so that ultimately is up to the district, right?
No, I'm sorry. I'm asking Joanna if that's included in the plan. I don't see that there.
I'm sorry, could you repeat that? I was trying to find the individual whose mic was on that we were hearing the background, so I apologize.
So according to the plan as it's written, the indication to tell a child to stay home is that they have symptoms and they should be self-monitoring. If they have symptoms, they should be at home. Correct?
If they have symptoms, they should be contacting their physician to see if it's at the level that they should get tested. They should stay home because we don't want them to come into school. In this situation, would be you're pooling it because you're trying to detect it. If it's detected, then you have the second test and you're informing the parents that, hey, this classroom, like keep an extra eye on whatever's happening with your students. And then what my understanding is, Ben, is they go on and they do additional testing. If one of the students tests positive, according to DPHS recommendations, they go into isolation and the classroom is notified to self-monitor and observe. If the board wants to go deeper than that, more restrictive than that, the board can do that. But that would be, instead of self-monitoring, having potentially a whole classes quarantine. So that's really kind of what the board decision would be. And I say that because if you're in an elementary classroom, or we had experiences in the middle school, John, where it was very hard to know who was with who for 10 minutes over a period of 2 days or whatever it might be, or it might be at their locker. They might, and it was very tough to do. So we would be sending a lot of students home in those situations. And I think that is why that recommendation is coming through DPHS. I think that's where they're coming from. But once again, that's a board decision. And, Dr. Greer is here as well. Is there anything you wanted to add, Dr. Greer, from the conversations and your following up with DPHS?
I guess I would just say I think the testing sounds fantastic. More information is always better. And I think it's very reasonable to get the follow-up test and, and once you're positive, you have to stay home. I mean, that's the way it is for everyone. So, but I also agree that, everyone shouldn't stay home who's not, had significant exposure. So I'm not sure if that answers your questions, but I think this is a great step forward to have better school attendance and more confidence.
Go ahead, MJ.
So I guess, can we follow up on that? So this is for the testing people. So the pool is there's one person that, or whoever, someone showed up positive in the pool. So now you need to go back and test the individual. What's the process for that? Are you like immediately on site the next morning in that class doing the individual swabs for the people? And then what is the turnaround time for the test? And if a parent who didn't consent to the first test finds out, oh my gosh, my kid's class has a positive in it, can I jump on the individualized test? Is that allowed?
Yeah, great question. So in terms of the timing piece, we schedule nurses to come on site, as you said, kind of that next morning when results are available, so that in the event of a positive pool, there are people there that can administer the individual tests. Those tests, so typically schools are utilizing a rapid antigen test for that, but you have the option of doing rapid antigen or individual PCR. And then to your second question, yeah, if a school, if a parent has not consented to the pooled test, and then there's a positive in the class, they could certainly consent and have their child tested using the individual test. Generally, we've found that kind of parents are okay with both or don't want to do either. Not that that's 100% of the time, but that's generally what we found. But yeah, they could certainly opt into the program at that time or consent for an individual test at that time and have the test run.
I have a follow-up question. What is your sort of typical or roughly average rate of parental consent for the schools you did this for last year? Yeah,
so as you can probably imagine, it varies quite a bit by community. I would say on average, like that range is between 40 and 80%. One of the things, so generally what we've seen is kind of first week, you have a lower consent rate. call it 30, 40%. Then, as folks both just get the reminders about the program or it comes across their radar, or have the chance to see what the program, like how it works and get a little more comfortable with it, that's when you start to see the consent rate go up. I think, like, for example, there's a lot of people here. So the test it's a anterior nares, lower nasal swab. A lot of people hear, nasal swab and think about the deep nasopharyngeal swab and kind of automatically are like, I don't want my child doing that, which is completely fair. And then as they see the program and understand like how it actually works, then I think folks start to come on board more. But it really does vary a lot by community, as I'm sure you can imagine.
Sorry, I'm just full of questions tonight. So you said the follow-up test, it's the school's decision whether they want to have a rapid antigen or a PCR follow-up test. And I guess isn't there a higher false positivity rate with the rapid antigen test for asymptomatic individuals, which is what we're talking about here tonight?
Yeah, so great point. So yes, there is. And what I would say is generally, I think for a broader screening tool, so if you're just going to say, we're going to regularly test 20% of our population or 30% of our population each week using a rapid antigen test, you're losing a lot of accuracy there. There's an interesting study. So Massachusetts started this program last January and has run it through the summer and is running it in the fall. And so they have done the pooled PCR following up with the rapid antigen. And there's an interesting study, which I can share with Joanne and I'm sure she'd share out. But basically they looked at what percentage of the time a rapid antigen test detected a positive within a positive pool. And basically and then they compared that to the CT values of the positive sample. So for those not as well versed in this stuff, which I would imagine you aren't because I've been steeped in this for a while, the CT value is basically equivalent to the viral load, or like how much virus was present. And so for a CT value under 30, which means high level of virus present, the rapid test did pick up an individual in a positive pool. I think it was 92% of the time. And then overall, I think it was about 76% of the time that it did pick up the positive individual. So certainly not perfect, right? And like none of these solutions are. And with the antigen versus PCR, right, you're trading off, essentially you're trading off rapid results and turnaround versus the additional accuracy.
So I guess you didn't answer my question. So is it the district that then decides whether the follow-up test is a rapid antigen or pooled PCR?
That's correct.
So have you thought about that, Joanne, what the second test will be?
Well, because it's federally funded and it doesn't make a difference cost-wise, I was going to go with the PCR test. It just seemed like that would be the best route to go. When I went into the system, when you click through things, there's a section that says, if you're interested in the PCR, click here. And so that would be the next part. My goal yesterday was to get the organizations like the schools into the system and the people who could access it, and then have this meeting. I wasn't going to go further if the board wasn't going to go in this direction, but that would be my preference.
Steve and then Lil.
So this is a question for the representative from Concentric. The statistics, the sensitivity rates that you quoted for the testing that you're doing, you quoted numbers for PCR testing, but is that for PCR testing from a lower nasal swab or from a deep nasal swab?
That's from a lower nasal swab. From
the low nasal, all right?
Yep.
I have a question for Ben for a logistical question. So I want to make sure I'm understanding. Your staff will come on the days that we decide to do the pool testing, and they will conduct the tests. It will go by courier back to where the testing is read, right? We'll get the results. If we have a positive test in the pool, your staff will return and we will do individual testing to follow up on that group. And then if we pick the PCR test at that point, as we're just talking about, then what's the turnaround time for them and what happens with that class that day?
Yeah, so the way you've laid that out is exactly right. So that's the logistics of it. The PCR test takes, the turnaround time on that one is 24 to 48 hours. And in terms of the policy in that waiting period, that I would defer to the district, as again, that would be a district decision.
So I guess that's my next question to Joanne. Then what would happen with that class that day while we're waiting for the return of to find out who's positive?
We would remain in class because the whole idea of this is we're trying to get out in front of it. And if we don't at least have this testing, we would have no idea at all that this was happening. So we would remain in class. We would then find out who the positive individual is. And then we would follow DPHS unless the board decides to put in a more restrictive stance. I mean, the whole idea of this is we wouldn't know. So how do we try to get this information as quickly as we can? And that's why there's an interest. That's why the SAS was actually created, was to try to get out in front of it. Otherwise, you wouldn't know. And I guess that's the goal. Is there anything other school districts have learned from this, or you want to add to that, Ben?
Yeah, so I would say that's in line with what most districts do. So most districts are saying, until we have a positive individual result, we're treating everyone as if they were negative. Again, the other option that you can do, right, is you can you get a positive pool. You can test everyone with a rapid test. If none of those tests come up positive, you can then reflex to a PCR, right? So again, like that's the trade-off with the rapid test. You are getting your results as soon as you have the pooled result and there's a positive, you're then in more often than not able to identify the positive individual right away. But again, it's a trade-off, and yeah.
Kristen is next.
Great. Kind of following up on that, I'd like to return to the question of how we can track vaccination status, because just reading from, the roadmap to return to school from, the education department, it says specifically, remember, fully vaccinated people who are in close contact with someone who has COVID-19 but do not have symptoms, do not need to quarantine, but should be, tested after exposure. So we're kind of worried about exposure, but we're kind of forgetting that we do have a vaccinated population, at least in part. So I'm really pushing to know hard numbers on who's vaccinated by class level. What about the first grade teachers? What about the particular classrooms? If we know that all the kids are not able to be vaccinated in K through 5 or K through 6, then we should at least know that the teachers and staff are vaccinated to prevent more spread. And I mean, I just wish there were a way to know, since we do have voluntary reporting, but there doesn't seem to have been, I don't know what's allowed and what isn't, and that's obviously a legal question. I know you guys have been checking on that, but is there a way to have better data? Because I feel like we still have an incomplete set to work with. For instance, if there's a COVID positive case in a 9th grade class, but we know, for instance, that 80% of those kids and teachers have been vaccinated, does that change any kind of idea about isolation or quarantine or something like that? So I'm just throwing that all out there to say, maybe we can find out a little bit more. And, for instance, follow up again on Power School once the parents like myself have finally filled out all of those forms, and maybe have some more hard numbers at our next school board meeting. For instance, maybe we can find out more updated numbers from the staff, school by school, grade by grade, the coaches, the athletic coaches, stuff like that. So I'm throwing that out there to say, I'm not sure what you guys have been talking about in your leadership meetings amongst the principals, and what we're able to ask for, but I think it's a completely legitimate question on the part of parents to want to know that their kids are, their teachers at least, and, from certain ages up, there might be a high percentage of vaccinated individuals.
Stephen.
When Concentrix goes into a class and tests all the students, do they test the teacher in the class as well?
Voluntary for staff. It's voluntary for staff and teachers, but staff and students.
Anything else?
I have one more follow-up for Ben. It seemed like you said at the very end in reference to MJ's question that it would be possible to do both rapid antigen testing and PCR. Is that what you're saying? That you could opt to do both of those things if you felt like you knew you had a positive case and then you decided to do rapid antigen and you couldn't figure out who your positive was from the rapid antigen and then you decided to do PCR. Is that what you were saying, or did I misunderstand?
Yeah, that's right. So what I think, personal opinion, a good strategy is, and keep in mind, I'm not a public health expert, right? I do testing, but I'm not a public health expert, is running a Abbott Binax Now or equivalent rapid antigen test on everyone in a positive pool. 7 or 8 times out of 10, you are able to identify the person or persons in that pool who are positive, and you're able to do that right away. But that's absolutely right. So if none of the rapid antigen tests came back positive, then you could do a PCR test, and that way you have the more certainty of the PCR.
Thank you.
All right, I think we're gonna move on. Ben, thank you so much for joining us and answering all of our questions.
Yeah, thank you so much for having me.
Ben, if you could stay, I know that you have something that you needed to go to. So if you are around, we haven't gotten questions from community members yet, but I do understand if you have to leave, and I could always write the questions down and ask you and send them out in a community letter.
Yeah, I actually have a commitment, but that's great. That works well for me. So if you want to, jot down any of the questions, and I'm happy to answer in writing and,
Sure.
and follow up as needed.
Thank you so much.
Thanks a lot.
be wearing masks. So Mike has has a few numbers for you.
Yeah, in terms of vaccinations, we have 227 total athletes.
Mike, as close to the microphone as you can, please.
We have 227 total athletes, and 68% of them are vaccinated, 23% are unvaccinated, and 9% declined to answer. And that does not include our coaches. Any questions about that particular set? Okay. I think that's.
How many? We had well over 100 athletes participating in the summer sports. We did have a positive COVID case with a student athlete, but there was nothing that we understood. The circumstances weren't such that we understand that transmission to have happened at practice. There's no data to support that. So once again, as last summer, we had a number of athletes outdoors participating without masks, without incident, save for that one positive case. InfoSnap information from the high school. This has really nothing to do with athletics, but I know you're looking for additional data. We beat the drum mightily to try to get people to complete InfoSnap. And for instance, I haven't done it yet, Kristen, so don't feel bad. At 200 people or so by the end of November, still haven't done InfoSnap, despite repeated efforts to reach out to them to do so. We will really, really make an effort over the next couple of weeks before we meet again to try to encourage folks to fill that out. And we asked twice, because we thought perhaps the parents might have missed the question on family ID. We asked twice to have them fill out that data when doing family ID. So 9% isn't too bad for those who didn't report.
Okay, now you guys have given us a bulleted list.
Yes.
I'm not going to ask you to read. We can all read that list. So maybe we should open this up to questions regarding athletics and co-curriculars. MJ.
So you're planning on playing your regular season, your regular conference. Like last year, you only played teams within the region, but this year you're proposing to just go back to the 2019 schedule as it was.
Yes, everybody in the state it's a statewide schedule. Yes.
One interesting piece is, I'm sorry, Will. We will be having fans, and we will be asking them to distance outside. I think it's premature to obviously talk about winter, but we feel that we can encourage distancing at those sites, and we will let visiting schools know that that's our preference.
Lil, you had a question.
Yes. In what ways are we limiting or encouraging masking for indoor meetings of teams, so like workouts and things like that?
Everybody's wearing a mask when they're indoors. Yes.
And is there distancing happening or is it just masking?
Just masking.
How about on the buses?
She asked, how about on the buses?
Buses it's mandatory on buses.
I guess you guys have done a great job. Doesn't seem to be any more questions. There may be later, so please don't leave yet. So what I'd like to do now is give, before we go to public comment, are there any questions or comments from board members on anything that we've heard so far from the superintendent, from Ian and Mike, from the fellow from from Concentric, anything at all that we want? We'll come to suggestions and motions after we hear public comment. But are there any other questions from the board right now? I know we've asked a few already, a number. Kristen.
I have one more question, which will be brief. I know that maybe parents have questions about, and you have told us this a little bit, Joanne, already, about when the kids do have to be out for quarantining or if they just happen to be sick. Since we're not doing remote, the expectation is that we're just going to follow the totally normal like illness policy, so the kids can get homework from their teachers and just follow along and communicate with their teachers and then come back after a certain point when they're cleared, correct?
We talked extensively at the fall 2021 back to school planning team, as well as individual conversations with principals. That is what would happen would be kind of if your child had had the flu or chickenpox, we would push that information out. We also have, better technology as far as being able to have a teacher's website, have that additional information, links, things like that, that they would be using. I know when I substituted, the teacher had lesson plans and all kinds of things that were already linked in that students had access to. We are in a very different situation than last year. So we have all of our students coming in 5 days. Last year, we had a plan of remote and in person. And it was sheer luck that we had these groups that we were able to have separate K through 5 teachers teaching fully remote and the other teachers fully in person. And then we would follow the same thing if the teacher isn't ill, but for some reason, the whole class was out, which is not the way that DPHS is heading, then that teacher would do virtual, but it was not sustainable. I think the teachers did such an amazing job that people think that that was pretty easy and doable. And it really wasn't. And so, in talking about coming back to school, there was real clarity that the teachers do not see it being sustainable. There might be some teachers in classes where there is that fit and there's an ability to do something that's live, but we are not saying that that's mandatory. That would go back to MOAs and everything else with the unions. It would be impact bargaining. And that's not the way that we built our system for this fall. I would say, I would have the principals please come up because I let you know that this conversation was coming. So if the principals wouldn't mind coming up and responding to this question, I let you know that it was going to come up about what would happen if a student tests positive and isn't in school. And we talked about it would be similar to the flu or chickenpox and links. So if the 4 of you could come up and maybe talk about the discussions that we've had. I would also say that a high school teacher mentioned that the fall back to school planning conversation that people don't realize that sometimes the students in the class really didn't benefit from the students who were remote because there was so much time taken away from the class to say, hello, are you linked in? Hello, are you with us? And she felt, although she did a masterful job, that it was really taking away from her ability to teach well. And she wants to spend as much time with the students in the class. Also, we talked about if a student's out for a period of time, the teacher would have check-ins at least weekly to check in. How are you doing? Can I help with the homework assignments? Is there support that you need? And there was agreement to that at the fall meeting that we had. And if there's anything, principals, I may have missed, we had lots of teachers and paras and nurses on that call. Please let me know.
Just echoing Joanne's comments, our teachers don't want to return to remote learning. It was exhausting for them. They feel their in-person instruction suffered despite their best efforts. Some people thrived at home, but that is a fraction of those who remained at home. We wanted to get our kids back in the building. Those who struggled with remote learning, when they did return to school, and a lot of them made that decision, they did better. They said, and that's no mystery. I think that's consensus understanding around the country with regard to remote learning at the end of last year. Because we're become experts at Google Meet, teachers never used to meet with students who were out for prolonged periods of time in person. It was always done by email or parents coming by in the afternoon to pick up work. I don't think our teachers are opposed to meeting with students during planning periods or during academic block now and again in order to keep that contact for those who are isolating at home. But there is no interest on the part of our staff. And there was genuine excitement when they heard they wouldn't have to teach remotely. Excitement might be too strong a word, but they want their kids in the building in front of them.
Teachers at MLS are much like the teachers in the other schools in the district, and they're very student-centered. So if there's a situation, I feel very confident that our teachers will make sure that they take care of the the needs of the students and the families, making sure that they have the materials necessary, and checking in with them as needed.
I echo what the other principals have also said. We're fortunate in Lebanon that the staff that we have cares extremely for these kids, and I've seen teachers do unbelievable things to make sure that kids are engaged in their learning. And I don't foresee that changing at all. For a child that is going to be out an extended period of time, I believe that they will continue to engage kids as best as they can, and will incorporate a team of people behind each child to be able to have them participate and keep them engaged and ready to return to learning when they come back.
So for those who can hear, John said that he would just repeat what has been shared. He doesn't have additional information to share.
Thank you, guys.
I have a question. Sorry. So I just wanted to clarify, we are still assigning a device to all students. Is that true?
Correct.
And so I guess one of my questions is, I agree. I think the remote learning was a Herculean effort and is not something that we can repeat. However, I don't want the students to lose their sort of robust familiarity and use of technology that might also still help them if they are at home, right? Like you're saying, being able to access Google Classrooms and access teacher assignments and various things like that. So have we talked about how those, now going forward, how those devices will still be integrated into classroom teaching? That makes sense?
Yes, I forgot one thing I was going to say. There were things from remote learning that we did pick up on, and we realized that are attributes to learning. So some of those things we are going to be keeping in place. Obviously, trying to maintain both a virtual environment and an in-person environment is difficult for anybody, but we are going to be incorporating some of the things that we did during that remote learning piece to enhance the education that we provide to our kids.
Great, thank you.
And as Dr. Roberts mentioned, every kid is assigned a device. If it's kindergarten and first grade, it's an iPad, or it's a Chromebook in the upper grades. Our computer people at our school, Matt Brady and Amy Gonzalez, went through all of the machines and actually assigned them with a name tag on them. They're ready to go, and they can be used as a tool to help kids if they have a prolonged absence.
Follow up, sorry. So will students still also be encouraged to take those Chromebooks home with them or iPads home with them every day? Because then if they do isolate at home, they'll still have that learning device. Is that going to be a policy that we're thinking about?
I know that was a conversation. I think the middle school agreed that they would be doing that, and I haven't had that at the elementary or high school level.
Right now, it's not gonna be required to be brought home, but as a need basis, on a needs basis at Mount Web.
It's going to be the same for HSS. Having kindergartners, first graders with iPads in their bags on buses and things like that was extremely difficult. If a child did forget them and they were determined to be positive and they had to be in isolation, then we made drop-offs to the houses with those devices.
I think there's some confusion at the high school. Maybe you can clear it up, Pete. I wasn't familiar with, I know we talked about it, but I didn't know it was absolute that we had every student with a personal device this fall. I thought we were going back to carts, but if that's the case, that's kind of news to me if we're doing it for sure. We had students who collected Chromebooks and had multiple Chromebooks in their backpack, in their home. And I would really like to perhaps not go that route and ensure that people who need one have one, but not to give them out wholesale. But I'm not sure that matters.
The big thing is we do have a device for every student. Some of them they've elected to put them into the carts. If we have to pull them apart to let them take them home, we have an issue with the power packs. We'd have to rip those out of the carts to be able to issue them and send them home. So if they're in carts, I think they're staying in the schools for use during the school. And if needed, we have enough to send one home on case-by-case basis.
Do we have any idea how many kids have their own computers in the high school?
No. And even if they do, they were encouraged to take a school device so that the platforms were all readily available.
And all of the middle schoolers, they each have a Chromebook. They're all labeled, cased, and they're ready to roll.
Thank you.
Did you have something else, Lisa?
Well, I guess I want to know, in the high school, do they have a device or do they not have a device?
They do. And if a high school student needs a device, we will make a device available to the student. That is what I think you were saying at the end.
So again, there is a device available for every student. And if we go to a remote setting, we'll have to, work hard to distribute them so we're all on a level playing field. But at this point, I don't know as if every student needs a device to take home at the start of the school year. Is that accurate, Pete? Yep. Okay.
Tammy.
So I don't really have a question. I just have a comment. I mean, it's obvious that a lot of time has been put into this back to school plan. And I think it's a sound plan. I think it's impossible to pre-plan for all the scenarios that could possibly happen. I think you've done, everyone has done a good job planning with what we know. The computers, for instance, the testing, the distancing, the assigned seating, the masks. As we sit here today, I don't know that we can plan for a lot of differences that we've discussed tonight. I trust that if something doesn't work, that we'll find out that it doesn't work and we can have a conversation. We meet twice every other week. I mean, if having them not quarantine with a positive case in the class doesn't work, then we'll know it doesn't work and we can have that conversation then.
Well, we're going to move on to public comment now, and the expectation is that possibly some of the concerns that people wanted to speak to have been addressed by the conversation that they've heard so far. I am sensitive that we have a lot of other material to cover tonight, and not the least of which is to come back and act on the 5-day back to school plan. So I'm not saying that we need to limit public comment to the policy stated 15 minutes, but I will stop the public comment when it sounds like we're not hearing anything new or it becomes repetitious. Is there any public comment in the room? Anyone who wishes to speak? Anything?
My name's Sean Pomeroy, Ward 3. Just to bring it up, I hate the mask idea. I wouldn't be able to sleep with myself if I didn't tell you guys that. I think it's a complete waste of time. But I recognize that nobody gives a shit what I say, and that's not important. What I do want to say is we have a presumption of innocence until proven guilty in this country. You guys have a cohort style testing Is there any expectation that after that test is proved, everybody in the test is proved negative, that class would then be allowed to not social distance or mask? Wouldn't that make sense? You just took 36 kids, proved them with your fancy testing that they are not COVID positive. Could they get the week off from tests, from masking, from social distancing, from stupidity? It seems like even the guy on that cohort was grossly underestimating how accurate any of these tests are, or terrified how accurate the tests are. He was terrified how accurate the PCR testing is. I think the entire thing is a waste of time. But if you're going to do it anyways, and you have negatives, can you get that class out of the COVID protocols because they're all negative? Otherwise, we're just walking around like zombies in masks. Thank you.
Thank you, John. Any other comment physically here in the room?
Did you have comments online?
Okay, let's go to the Zoom comments then, please.
Faith, who is in Ward 2.
Hi, I'm Faith Henriksen in Ward 2, and I just wanted to point out that the reason that there was not a lot of spread last year in the school itself was all of the heroic mitigation efforts put forth by the teachers in the school system. So I just wanted to commend everybody for that. I did have a comment about the pool system. So if there is a positive case identified within a pool, then, and testing identifies one child that's self-isolating, the other ones could monitor, because if everybody was masked during exposure to the positive case, then that masking likely would have prevented the spread of those students from the positive case, if all of them were masked. Then within another week or so, or how often the sequence happens, another test would be able to flush out any more positive cases, especially if they're asymptomatic. I have another comment on the nurse, the vaccination status of the students themselves. I'm just wondering if putting on Power School whether or not the student is vaccinated might be intimidating to some people, and that people might want to be pointed out that the nurse would keep the student's identity private if the parents or guardians wanted to express whether or not a student was vaccinated. And then any of the data that came out from that could be collated into this many are and this many aren't. And that the nurse by law cannot divulge who that person's name is or any personal information. And that people might be more comfortable with expressing that data to the nurse, either privately or with a photocopy of documentation, or even reasons from the doctor why they can't, that sort of thing. And that really the nurse should be the point person for all that kind of data. I'm highly in support of masks. I think that will help stop the spread. It won't make people zombies in the least, and it will definitely capture the aerosols just from breathing in and out, as the science has proven. Thank you very much, and thank you for all your work on this. Please mask the students. Thank you.
Thank you, Faith. Who else have we got, Joanne?
I do not see any further hands raised. And you're seeing what I'm seeing on the screen, so I'll go one more time. None.
We will that.
I do have a Dr. Greer, if that Dr. Greer wanted to make a comment. So
please
go ahead, Dr. Greer.
I just wanted to comment on, it's a really good question that the first individual brought up about if a class is determined to be negative, can they then have the week off from wearing masks, et cetera? I think that would be a mistake, because at any time you could become positive, and the rates, we got to make sure we continue to be safe, because at any day that could change. And I also wanted to comment, the individual on the board asked about, can we know who's vaccinated and who's unvaccinated? There's obviously a lot of inherent problems with that. And I think we have to continue to remember that people who are vaccinated are actually getting sick, less sick, but also able to spread it. So I think just assuming that everyone has to follow the same precautions is probably the best, and knowing might make you feel better. But, where I work every day, we still are wearing full gear, assuming that we could spread the virus, even though we've been vaccinated since January. Thank you.
Thank you.
Thank you for joining us this evening. Appreciate it.
Thank you.
Okay, public comment is closed. Okay, we now need to take some actions here. I think at the end of the day, we need to have an approval of the 5-day reopening plan, and we can go right to that right away. But my feeling is, if there are some tweaks that people want to discuss and propose, whether it's from the pool testing or masking or anything else, this might be a good time to bring those up. If there's anything like that, I'm not soliciting them, mind you, but if they're, Stephen.
I would like to see us decide on masking versus the remainder of the plan as separate issues.
Could you say that again, please?
I would like to separate the decision about masking from the rest of the plan. In other words, there may be some that are in favor of masking, but not in favor of other aspects of the plan. That's my concern. And I'd rather, if someone feels they have objections to some part of the plan, not be forced to vote down the entirety of the plan because they object to one part of it.
I think we should also think carefully whether changing something at this late date before school starts is something we want to do. Joanne's communicated this plan. We may disagree with individual pieces of it, but we will continue to monitor the situation, can make changes as the school year goes on. So I think my concern would be changing something now when school's starting in a week.
If I could, I mean, we always knew that we were going to be doing board approval fairly late on, and so I think that if there are changes that the majority of the board feel needs to be made, I think we're just going to have to deal with it. But I understand your point. Maybe what would make sense, what I would propose then is perhaps we should start with a motion to approve the plan as it was outlined here tonight and see where the discussion goes. And if it looks like we're not going to have a clear majority supporting the plan, then we can go back to Stephen's position of perhaps separating out some components so that we can have a coherent plan that everyone agrees with. So unless anyone has a strong objection to that, I wonder if I could have a motion to approve the 5-day back to school plan that Joanne outlined in her presentation, with all the various parts, the masking, the pool testing, the provisions for when an individual test positive, various elements of social distancing, and I would say the athletics and co-curriculars as well. And anything else I forgot.
Make a motion. I would like to make a motion in favor of the 5-day in-person back to school plan that has been laid out to us by the superintendent.
Is there a second?
You want to say including the co-curricular? You want to add that?
Oh, sorry. Yes, and the co-curricular activities.
I'll second.
Second by Tammy. Okay, let's have a discussion and hear what reservations there might be.
Ed.
I'm sorry, go ahead, MJ. I'm looking in the wrong direction.
That's okay. So I guess in general, I think it's a very solid plan. And I think you, Joanne, and your team has done great work over the summer. I guess the only part of the plan that I have reservations about is the testing and the pooled testing, because I think that there are still a lot of questions to be answered about the follow-ups and what happens when there is a positive in the class. I guess I would like to have seen that policy a little more developed. But at the end of the day, I think I'm still supportive of the 5-day back to school plan because it does come down to parental consent on the test. It's not mandatory. So I think that that at least helps with some comfort level on the 5-day plan.
Tammy.
And we acknowledge if something needs to change, we certainly can change it, you know, as the year progresses and things. If something needs to be changed, then we'll discuss it. You can let us know and we'll go from there.
Jenica.
Like MJ, I do think this is a very solid plan and has been the fruit of a lot of work over the summer. You know, I personally am a little bit reserved about the mandatory masking, but I would like us to consider that going forward. And like Joanne said, it's easier to remove layers than add them. So I support this plan as it's written.
And I'll just second what Jenica just said. I find it a very strong plan. We've known most of it for several months. You know, the masking we were hoping we wouldn't need, but I think it's a smart idea to start with that and just keep monitoring things as they go along. So I'm in favor of the plan as it stands.
Oh, and if sorry, I can just add, I'm also very in favor with the state recommendation that students in the cohort of someone who tested positive can still remain at school unless they have symptoms. I think keeping kids in the classroom and not having the breaks for their families and for them at home, I think is, you know, the more we can do that this year, the better.
I'm sorry.
It's Stephen first.
I think
Lil, then Stephen. Sorry.
I jumped ahead. I'm sorry. That is the only sort of, for me, the only weak link that I see in the plan so far, which I agree is very strong and I support 95% of it. I think the only question that I have, and this is understanding that these are the recommendations from the state, is what to do with this. Once we've identified a positive case in a class, what to do with that class. And I don't think that, I agree that the goal should be to keep as many children in the classroom for as long as possible at all times. However, I just want to reserve the right for us to, if we then end up with a cluster after a class has done that, right? After we've had a positive test, we've kept that class in until we find out who the positive is, then that person goes home and isolates or quarantines, and then we have a cluster break out in a class in that way. I do want us to recognize that we might need to revisit that idea, that part of the plan.
Stephen, you had a point to make.
So I agree that I support the majority of the plan. And I think as a whole, it's a very well thought out document and plan. I'm very much in favor of universal masking. I'm very much in favor of keeping all of our kids in school as much as possible, but not at the expense of safety. And I think our role is to do whatever we can to promote safety of the kids. And I have concerns about the methodology, the testing, and what the protocols are when kids are identified positive. And those issues to me are strong enough, important enough that if they're part of the plan as a whole, that my personal opinion is I can't support it.
As a point of information, Joanne, how did we, would you just remind us all, how did we handle positive cases in the spring within a classroom? And I know that there weren't, that these tended to come up, a lot of them were when kids had been away and they weren't in the classroom, but there were some cases where.
So there were not cases of clusters because a cluster is defined of as a transmission between 3 or more students in the school setting. So we had some students who had play dates or they drove in a car together and one was asymptomatic or whatever, and they tested positive, but it wasn't a transmission that was happening within the school building, it was outside. And so we never had an identified cluster. I'm looking at Ian, but we've had this conversation and looking at the group, but we were not identified as having a cluster. The closest one was a situation which was right on, kind of on the edge of the sense of a student that came in, had some symptoms, and we think that like a classroom teacher and another student might have had transmission, but it's really hard to go back in time because one of the students was a peer. So how do we know exactly when that transpired? So what we would do is if we learned of a positive case, we automatically call DPHS, and they will return our call, and then we start contact tracing. So we say, what classroom was that student in? And at that time, they had the up to 10 minutes within 3 feet rule, which they don't really have anymore. And so we would do kind of a circle. With the younger children, it was very hard to figure out who was 10 minutes or more with 3 feet or less. And then that's when schools started to quarantine classes throughout the state. And that's when the DOE came through and said, you need to have a waiver anytime that you have a cluster out or a classroom out, you have to contact us. So not only do we have DPH layer, we had to prove X, Y, and Z to the DOE to get a waiver. And that was happening at the end of the year. There was one person in all the DOE, we couldn't even get waivers reviewed and information back in time. So that was very frustrating from a health perspective. But we always follow DPHS. We found that that's helpful because when you do have parents who ask, you can say, this is the recommendation from DPHS. And it's just really helped us because we were able to go back to a document when parents question and say, here's the document, here's what we're following. And at times we would err on the side of caution if DPHS hasn't gotten back to us right away. This year they do have a weekly phone number and then after like a weekend number. There's never enough staff. And what we're gonna find is we're able to get a hold of them fairly, within a couple of days or so. We're making internal decisions between then. And once schools go back and the cases rise, they're really going to have to stay on it as far as getting back to schools and having conversations. So I've been very fortunate. We've been very fortunate to be able to reach out to Dr. Greer in the meantime and say, as our school physician, can you give us your recommendation of your interpretation? So that was really helpful. And then in the upper grades, it was very similar protocols. So it was contact tracing, figuring it out. We also looked at who was assigned seating on the bus. And we would contact those parents to say a child that tested positive, it's probably a good idea for you to test. And we were very fortunate that many of our families went right out, got the test, and fortunate that they called us back. And I don't want to decrease the emphasis on, I'm so grateful when a parent follows up with symptoms and lets us know if there's a positive test. We appreciate that. You took the time to do what you need to do for your child, but you're also protecting everybody else by letting us know as soon as possible, and the staff and the parents were really good about that. So it's a complicated process. We got down pretty good at it because we were doing it multiple times. Now the recommendations from DPHS, as you all are aware, have changed a bit about quarantining. So that's a conversation that this board would potentially have. It would be an additional restrictive layer if you were to go more than DPHS, but I emphasize it's always a local decision.
Well, that's the conversation we're having though right now.
Right, but it's a local decision, but I'm trying to let you know what we did last year and how it was helpful to follow the regulations and the guidance. If the board decides to go in a different direction, I would just need to have real strong clarity because the parents are going to email and ask and call. And I would just have to have a very clear response.
Ian, did you want to contribute something? And then we'll go to
I'll
Elisa.
be real quick. Steve, maybe this helps alleviate your concern. I don't know. Last year we started at 6 feet. If you were within 6 feet, you had to quarantine. Eventually that went down to 3 feet, which we have everywhere in the building. For instance, at the high school, and I assume everywhere else as well. And once the threshold for quarantine was within 3 feet or less, we stopped quarantining kids because our chairs were such that they were distanced to that degree. Now it is different if they were in a car together over a prolonged period of time. We did have kids quarantined in that setting. But as far as the numbers of kids who had to quarantine shrunk mightily to nil in the school setting.
Lisa.
So my only comment is that I think the plan seems sound, and I want to make an emphasis for all of us as we move forward and as we're thinking about all of the things that may run under the category of safety, is that we are really in a situation right now where the safety of our kids involves more than just their bodies. They are needing to be together and they're needing to be learning in a more social environment. And we have the responsibility to include that in our discourse as we are moving forward, because if Dartmouth had 4 kids that killed themselves last year, and we have a situation here where if 4 kids had died from COVID, we would be up in arms. But we have a real serious issue with mental health right now, and we need to be tracking it as carefully as we are with our COVID cases. And I think that because that stuff can run undetected, and because there's so much stigma around it, and because there's also the health issues, we're not allowed to get a hold of that information in the same way, that we are probably missing something right now if we don't make that more of an issue. So I don't know what we could do in this plan. It seems like the plan has already been using or thinking about these issues. And I'm grateful that you started having those conversations with people in the spring, because it was a big concern for me last year as well, as I was watching kids and seeing how they were behaving. And I think that we have a lot of concern about whether or not they're going to get the virus, but there's a lot of other collateral damage that's happening right now. So that's all I wanted to say, and to make sure that we keep thinking about it as we make choices.
I don't see any other hands raised. My point of view is I have also been a little bit troubled about just how we respond when there is a positive case in the classroom. But I think as Tammy said, I think it was Tammy who said a little while ago, we cannot pre-plan for every eventuality. I think what we saw in the spring was that we were flexible enough and responsive enough to deal with problems when they arose. Look, we understand that we're on our own. These are local decisions and have to be made. And I'm comfortable with the plan as it's currently laid out. And part of my comfort level is the confidence that I have that if such situations change, or if it turns out there are problems with executing it, that we can respond very quickly. Stephen.
Can I just add an extra comment? I agree, and I want to echo a sentiment that Joanne has raised multiple times. It's she has often advocated that we start with all the layers and peel them back when we see they're not necessary anymore. Starting without some of the layers and saying, well, if we get an outbreak and God forbid, someone get gravely ill and dies, we can always add back layers. I have a problem with that approach. I'd rather start with the best protection for the kids And when the data says, you know what, it's looking better and better, we can peel those back. That's my opinion.
I guess,
MJ.
I guess a point of clarification, I thought I heard though that if there is a positive exposure within the peer group or whatnot, that the parents will still be notified. So a parent could still make a decision to pull their kid out of school and isolate them, right? Nothing is preventing that within the plan, and we'd still support their learning. So I think that, again, this plan, to go with other people's thoughts, is really, we can't plan for everything, but there is still parent choice to make a decision what's best for your child and your family if there is a positive case, because they are still going to know about that positive case.
Would there be, if a parent decided to do that and decided to say, isolate their kid for 3 days, right? That's sort of 3 to 5 days is kind of the thing when you're looking for symptoms, right? They decided to do that. And let's say they had to do that 3 times, 4 times, or they decided to do that 3 times, 4 times over the course of a year. Would that put them in violation of truancy laws at that point?
We don't know. You know, it's just, that's the uncharted water thing. And we have a duty to review our policy in regard to truancy, which is a complicated policy. And I think it's one that may have been updated. So I asked my assistant to please pull it because we were talking about it in another way. My sense is our staff and our school administrators know our families and they know our children. And if they know that this is the reason that the child is not being in school, and it's not a pattern just to avoid coming to school, and that the child is engaging however they can, I would have a conversation with them and support that this is a parent decision and it's not truancy. But we wouldn't want to see this as a consistent pattern that there's a positive at the middle school, so I'm taking and having my child be home. You know, that because we're offering 5 days in person, we have an obligation that the students are in school those 5 days. But I do think this is an opportunity to kind of talk about partnering with parents and students and having a mindset of flexibility.
Right, agreed. I just wanted to have us articulate that because I think it's important because we do have policies about that on the books already.
I'm going to call a vote on the motion at this point. This was a motion made by Kristen, second by Tammy, to that this board approve the plan as laid out by the superintendent tonight. All in favor, and I'm going to ask you to keep your hands up so that I can read out what the votes are, because we don't have a minute taker tonight. Let's do that. So all in favor, please raise your hand. Yes, from Tammy, MJ, Lisa, Jenica, myself, Kristen, Aaron, and Lillian. Opposed is Stephen. Motion passes 8-1. Thank you, everyone. That was an excellent discussion. Next item on the agenda, the last item of unfinished business, is discussion approval of school board goals for the coming year. We started talking about this during our meeting at the beginning of June, and we agreed that we would revisit them at this point. I'm just trying to find the document that we all got.
It's the last page of the packet.
Here it is. And I think the most efficient thing to do is to get a motion to approve these goals, and then if they need to be modified, we can do that by amending the motion, or simply rejecting it and starting over again. And these are the goals that I believe, by and large, we talked about at the board retreat that we had.
I'll make a motion to approve the 2021-2022 board goals.
Approval moved by Jenica.
I'll second.
Second by MJ. You have discussion, please?
Just the only point of discussion for me was just, yeah, the facilities. I mean, obviously, there's a lot of stuff within the facilities and capital improvements. So this is just a general overview here, and are we just going to leave it at that, or do we need to have any more specificity about what, you know, we talked a little bit in our retreat about is the, you know, what's happening with the ESSER funds and the projects and leftover money versus what we might need to raise money for in the future. So just, I guess this is more my question. So this is obviously what we put together as a group and you drafted. And yeah, how does this stand, I guess, over the course of the year?
Yeah, I think the purpose of having these goals is to, I think, help us to guide our work through the year, so that if something comes up that someone wants to put on our plate, the first question we ask is, well, does this align with any of our goals? And if it doesn't, then it better be a pretty important thing in order for us to spend time on one of our committees or time as a board discussing it, understanding that things come up. But I think that's the purpose of this document, not necessarily as a detailed roadmap of steps.
So Kristen, are you asking if we can add something to it?
Well, not necessarily. I mean, Dick kind of answered my question, but also, you know, obviously there's a lot of documentation in here about the projects that may be able to be achieved through the ESSER funds, you know, the track renovation fundraising, and, you know, the Sem Hill building, and then also, of course, you know, the longer term plans of other kinds of the modernization that's not fitting within that piece. So that's, I just wanted to see if that maybe could be on the long list of things, you know, the other modernization issues for the various buildings, modernization / expansion of some of the buildings that might not be underneath these various projects.
I hear what you're saying, and my intention in putting this together was that is incorporated in 2 words called urgent projects.
Okay, excellent.
I mean, and again, this is part of a discussion we can have at a later date. But I think the terrific benefit we could derive from ESSER funds is it's going to give us the opportunity to do some capital projects that have been part of that much larger capital improvement plan that we've gone to the voters for, you know, 3 times already. I mean, I would then focus on other facilities improvements that are truly urgent to the district, and we all know what those are, and that's what I intended to be incorporated there. I certainly didn't mean to exclude.
Right. Good. Thank you.
Any of those items on the capital improvement list. Will.
I do remember, and looking in the minutes, or I think I was right. We did talk about communication goals. Sort of, we talked about how we can improve our communication with the public, through the website, through community engagement, that sort of thing. And it just doesn't seem like that kind of filtered into this set of goals. So I just wanted to revisit that quickly.
I guess I need to start responding to it since it's my document. I guess my feeling on that was I wasn't exactly sure what, and I think it was you, Lil, who brought it up, just what you had in mind and how it would be addressed. I mean, right now, all of our communications are put through the superintendent's office, which I personally think is the way to go. But I think if there are ways to improve that and to further get the message that the board as a whole wants to put out and the district as a whole wants to put out, I think that's certainly a worthy goal that in my view could be included. But if we were to take it beyond that and be thinking about new communications initiative, that's something that I would, as chair, want the board to approve, because that would truly be something new. And that's why I didn't drop it in, because I didn't get the sense that that was something that was that had a great deal of consensus among the board. So Lisa, I think you had.
Well, I just wanted to know about both of these two suggestions. If we just added review communication plan could be one thing, and then review new building or building renovations as part of our goals for the year. It seems like both of those things are things that keep coming up if we just add them to the list.
So would you, your second one first, would it be all right to include under detail on facilities, urgent, on a separate line, urgent product / facility improvements?
Sure. I mean, anything that articulates.
I mean, that would,
yeah.
I think that would capture it. And the communications piece, I was just thinking, could that be incorporated into our work on the strategic plan?
That's what I was just going to suggest.
Yeah.
Actually, yes, that it could be a part, and it could very well be a part of this, of our survey, right, of the community. How is the communication? How do you feel that the communication from the district and from the board is working for you, or do you have suggestions for that? I think that would be a good place.
And we're going to be discussing that as part of Superintendent's report, part 2.
Okay.
Great. In a few minutes.
But that seems like a logical place to put it, and it still fulfills what we were talking about.
Okay, so can we, if it is understood that the strategic plan should include a component on district communications? I'm putting that in detail.
And I want to separate out, for those that aren't familiar, the strategic plan that we create is goals that administrators are supposed to meet. And if the board, we've been talking about this for years, that the board should have a strategic plan that the board members have responsibilities to do. And what I mean by that is people could say the board should communicate better. I have no control about how the board communicates. So we continue to kind of talk about it, and the goal, the concept of the strategic plan was for me to be able to map out the focus and the synergy of the school administrators, the teachers, and I've always welcomed a board plan that aligned with what we were doing in school so that it was in sync. But you had steps and target actions from the board level. Board members are responsible for X, Y, and Z, just because I don't have control over that part of it. So I can see this very well, a great year to dovetail the two and be like, we're approving what school administrators want to focus and look at the same time. Since we've had these conversations, I've talked since last year about having a community forum again. And the community is not only weighing in on the school administrators one, but also on the board's one. So that if we end the year in May with a 3-year board plan that aligns with the school one, we finally have accomplished something that we've talked about for a while. And it doesn't have to be huge. It just kind of dovetails to support the work that's happening in the schools.
Right. So there's nothing inconsistent with getting Lillian's request in there with the strategic plan, and also for facilities improvements to specifically be included in the.
And the board should just be aware of the fact that I've moved away from modernization. My strong feeling is that these are dire need renovations. We have students who are learning in closets. We have ADA inaccessible entrances. So we're at the point where if the facilities, if we have a great academic social emotional program, which is first, we should have facilities that are equitable in that sense of that are really up to date and up to code and accessible. So I think for me, I've moved away from the word modernization because we're just looking at projects that we hope the community will support so we can finally get them done in the school district. So if you hear me use renovation, I just wanted to give the background why I'm kind of using that word instead. Modernization sounds fancy, I don't know, glass and lots of lights and stuff like that. And I want our projects to be whatever they are, to be great. But I do think that there's a stronger need to just start to act on them. And I hope we can garner community support to do that.
So with those two amendments, can we get a vote on this, please? I think my sense is that we're pretty much in agreement.
Yeah.
If I'm wrong, stick your hand up. Okay, all in favor? And that vote is unanimous. Let's see, where are we here? Okay, we are now going back. We just finished item 9. We're now going back to item 8, SAU leadership team updates. And we'll hear from the superintendent on strategic plan survey and the equity audit update. And then we'll move on to the BA report.
So I've provided a lot of information, documentation about the work over the summer. So the best way for me to talk about those topics and to do my superintendent's report is to just go through this document and answer any questions that people might have. So in regard to school health and safety matters, I've attended multiple conference calls and virtual meetings with not only DPHS, but the regional public health network administrators to keep up to date on the rates of transmission. And I've also provided notes, communicated and coordinated with the Hartford Community Coalition and the Upper Valley Health Network for summer meal delivery. And I attended the virtual meetings with DPHS regarding voluntary COVID testing for students and staff, completed the paperwork for staff, for SAS, and SAS is what brought us to Concentric, which spoke with us this evening. And there's a paragraph about the work that I've done to try to get the voluntary testing up and running early in school, which is a lot of communications back and forth, and also a new learning curve for me. So there's a lot to do with that. So I've sent the superintendent's letters to board, staff, students, and families throughout the summer, and there were inquiries about our response to COVID. I emailed those community members back. The plan that we just approved, and we are coordinating our flu clinics. So we were first to hop on that for October 20th and 21st. So ESSER 3 funds, that's our next conversation. So this should help provide a good overview. I've attended multiple virtual meetings and conference calls with the DOE to keep informed about it, and facilitated a meeting with Tim Carney and Tim Ball and others to review the projects before I put them forward to see if they could be under consideration. We looked at federal and state regulations regarding the ESSER grants, and we have conditional approval for some projects. So the next step is for the board to let us know which direction you want us to head, and we can get bids and we can find out how much those projects would cost. We're also open to entertaining ideas about other concepts. I will share with you that there are a lot of hoops to get to the point of getting conditional approval. And the state put in a note to me that they were very, my words, but I can't remember exactly, but they were just very impressed and appreciative that we followed all the steps to try to get to where we were. So impact fees, I had a lot of work with impact fees and attended meetings with Richard, and Tim and Dana also provided a lot of information to Bruce Mayberry, and Richard's going to give you an update on impact fees. So with the equity audit, a lot of communications by email and phone with MAEC. And as I mentioned, they charge their fee structure so that now there's a charge for each affinity group, and the report would be well over $50,000. And we had a momentum meeting, and our leadership team talked about the equity audit and the results of the strategic plan. And we're concerned that the surveys are not specific to our district. And we'd like to work with a facilitator who has a lot of experience in the field, who would develop a more meaningful survey instrument, assist with building district-wide capacity, assist with curriculum development and review, assist with updating the website. I'm very interested in attracting applicants of color, applicants who will bring diversity to our staff pool. And so I would like assistance from a facilitator on how do I do that? And how do we attract applicants? And also assist with developing our action steps for the next strategic plan. Because if we're going to put all the effort in and the cost in to do this audit, let's get something out of it that we can use for the next 3 years. And I'm looking into possible ESSER use funds and other grants to fund this important work. To Lisa's point, I'm working with Alice on the fall 2021 Superintendents and Social Agencies Summit. We actually met for over an hour today. All together was there. There's different subsets of groups. We want to focus on mental health. And so we are doing something like ECHO, if you haven't heard of ECHO, where there's webinars that have specific focus. And ECHO already has a couple that align with our school district interests. And we're going to create some more to build that capacity around mental health to be able to, what if parents ask to work with a certain agency, but the waiting list is really long? Like, how do we help those parents and families in the meantime? And so I also attended webinars on the discipline laws, divisive concepts, the new laws roundup, and board policies in response to recent legislation, and also another legislative recap. And I pushed that information to board members so you'd have it as I was learning it. The anti-bullying webinar, and I'm also collaborating separately with DHMC to offer a suicide awareness and prevention webinar, 2-hour course for Lebanon staff members. And then if we don't have the whole class filled, we'd open it up to any school district staff that would like to participate in that. I will be doing the Vital Communities Education Day, which is a full day focused on education from UVEI. I met with Rob Schultz. I've coordinated this with HACT, and I've created an agenda for a full day. What it is it gives an opportunity for people who aren't in the field of education to get an understanding of what goes on in schools. A lot of people don't have that background knowledge. I've also prepared in advance the policies and sent those out to policy committee, the ESSER work, and have been in touch with F&F members. I've been in touch with PNN in the sense of just, we know we're going to be meeting fairly soon, and I sent out the CBA to review and ask if there's any points that people would like to focus on. And once again, from all the emails I've sent to you, I've just really tried to keep everybody in the loop this summer. I was asked by the editor of the Lebanon Times to write an article about returning to school and our areas of focus. We did have a momentum meeting that we focused on, and other things such as grant reports, applications, which I will bring forward to the next meeting. I'll actually send you the new hiree list sooner rather than later. In contact with LEA and LSS union presidents, to the Grantham superintendent, and we had a conversation about a student transitioning, and also tried to keep in touch with local districts about their back to school plans, because we're all figuring it out together. So that's certainly not all the work that I did over the summer, but I hope it provides you an overview of areas of focus, and I'm happy to answer any questions.
Lil.
So I wasn't here for the last momentum meeting. So can you just tell me what the momentum meeting is, who it involves, and what the purpose of it is?
Yes, a momentum meeting is open to all of our school district administrators. And I call it a momentum meeting because a retreat, the definition is to move backwards, and I don't want to move backwards. And it's a great day that we spend together before school starts every year. It's a great way to, we haven't had a chance to be together in a really long time. In the morning, we did small group and large group discussions that I facilitated around the MAC audit. And we talked about the questions, and we talked about how we might rate ourselves to get a sense of an idea. And then we also said, well, this is something we want to put into the strategic plan. So I kept those notes. And then in the afternoon, we looked at the strategic plan results. And then we were like, hey, this is interesting. This connects well with here. Let's think about that going forward. So that's what our momentum meeting is. And Dana has been very gracious in allowing us to go to his house. So we all meet at Dana's house and we bring food, and it's a nice way to kick off the school year together. If you have questions, please just let me know.
Thank you.
You're welcome.
Let's move on to the business administrator's report. Update.
Yes, I have a couple of things in the packet. I don't have much of an update in way of budget. I'll just say books are closed for last year, and there's a report due to the state on September 1st, which I'm probably 92% done with. And so that'll be that's the report that helps set tax rates. And so we'll talk about that at our next board meeting when it's after it's complete. I included in your packet is a ESSER funding update. This is all the money we have in the pipeline at various stages. And I just highlighted, I think it's black and white, but I highlighted the 5 streams of money, I guess. ESSER 1, and I'll just go through these quickly. ESSER 1, these are abbreviations. It stands for Education, Elementary and Secondary School Emergency Relief Act, I think is what ESSER stands for. It's COVID money from the federal government. ESSER 1 was passed right after the pandemic was declared, and we received, and then all the way to the right, we received $230,000 for that. There's a supplemental public school relief fund, and I actually don't know the funding source for that. I think the state was given that money and held it back, and then they released it to us later. It's the same money but different. It has to be accounted for separately. That money. So the ESSER 1 and the other ESSER funds coming up are treated like regular grants. So there's a grants management system to the state that we access for whether it be for IDEA or title money or this ESSER money, where you have to go into the system and you have to write an activity they call it. You have to write it in, and then Joanne hit submit, and then somebody at the state approves it or says, no, you got to change something. So the ESSER money worked that way. The SPSRF was actually a reimbursement, and that what it actually functionally did is it replaced for us what we originally thought we were going to get FEMA reimbursement for PPE and stuff, and we didn't get that. But thankfully, the SPSRF money was released, and so we were able to use that. That money had to be spent in whole, not only spent, but a product received by December of 2020. So that's why that money is all completely gone. And the first pot, as you can see, is just about gone too. There's a couple $100 left. We did have to, because those are the 2 pots of money that we have functionally have now. We did have a few more expenses that we took out of the general fund of $23,000. Obviously, there's no budget for that in our general fund. This is the year that just passed. Carissa, ESSER 2, it's supposed to be ESSER 2. I think I screwed up my parentheses. Sorry about that. ESSER 2, that was the legislation that was passed in December. And of that, we were allocated $1,070,000. That's all the way to the right. I say it's unallocated and unspent. What I mean by that is that we have these, as Joanne mentioned, we have pre-approval from the state to do these 6 things. So we submitted some paperwork saying this is what we want to do and this is how it relates to COVID. And the state came up with a process where instead of putting everything to that grant system and submitting it and then waiting for them to kick it back and say change things or forget it, they came up with a pre-approval process where you just say this is a general view of what we want to do. What do you think? And the pre-approval process hopefully will cut down on the back and forth. So now once we know what the board wants to do, if it's on this list, we should be able to submit a grant application to the state through the system, hopefully pretty easily. And once that is approved, then we have that $1 million to spend. And then ESSER 3, I think it says 111, ESSER 3, my eyes must have been crossed that day. I apologize for that. ESSER 3 was the March, that's the ARP means the American Rescue Plan. For that, we were allocated $2.4 million. We haven't, besides the conversations that the board has been having or will be having with Joanne as far as facilities or whatever, that's the only conversation we've had about that. What we do know is that 20% of that last pot of money in the law says it has to be allocated to learning loss recovery. So 80% you can do for pretty much any of the rules of the other ESSER funds, but 20% has to be reserved for that. That's not a lot of guidance, but that's the guidance we know of. So
now I'll add that maybe I'm just not seeing it, Tim, but the MLS nurse's office was also a pre-approved. You have a behavioral support room. I don't see nurse's office. I just want to say that because we're going to talk about it next. Thank you.
Tim, can you just explain what learning loss recovery is exactly?
I'm not. I'm not really sure I can. It refers to, I can tell you that the intent behind it was COVID affected kids' learning and how are you going to address getting them back to where they need to be? But that's Tim's definition of my understanding of the law. I'm not sure that I'm not sure there's a definition clearly spelled out.
There's a paragraph in ESSER that provides specific language. I would like to put in to see if I could get approval for the diversity work to pay for it out of it, but I'm not quite sure. Some of the things that are listed as to purchase curriculum. Well, we already paid hundreds of thousands for art. So I know that superintendents, some are feeling very frustrated because you have to use it, but what if you already have it in your budget? What if you already thought, you already have it going? So there are going to be a lot of questions, I think, about the 20% and what it really means and what they're going to approve.
So have you actually gotten reimbursed for the first two items that you've spent, the 230,000, the 265, or they've just been spent?
The 265. So the top two.
Right.
I made a box around the 229, 866 and 265, 400. Yeah, that money is already.
No, it's been spent, but have they reimbursed?
Yeah,
us?
yeah, that's all taken care of. And it's that report I'm talking about. One of the things you have to do. Yeah, that's all done. And with this 500, that first ESSER one has to be done by the end of September, and there's $500 we have to spend. So, and the second pot of money was reimbursement, and they paid us already. So those two are off. Those are all done. The top three are all done.
Well,
in the listing after this of the ESSER 3 projects under consideration, are you saying that these are ESSER 2 and 3 projects? The money can go for both of these 6 projects?
In our discussion, at least in our preliminary discussions over the summer, we're treating them as sort of the same pot of money, but recognizing that 20% of that 2.4 has got to be used for something specific. The rules of the other two are the same. The rest of the pot 3 and all of pot 2, the rules are the same, and we have to write them as separate grants. But
they can cover similar things.
I think we can count them, treat them together in your minds.
Okay.
Aaron.
Since we have pre-approval, is there any chance that we start putting some money out there and then they say, no, we really didn't mean that?
Yes. We all read the email the same way. I went, what does that mean? Because it was pre-approval, then you invest in your design planning, the district invests in all these other next things that we have to do, the bid process. Then we give it to them again to see if you get approval, which is frustrating because you've got the conditional approval, you're using your funds to get to that next point. I think what Tim was saying is the hope is that if you have this conditional approval, that you're in pretty good shape because they've already reviewed most of it. But I think it gives them a bit of wiggle room to then say no, because they've had some schools that went ahead with projects and didn't follow all the steps, and they had to go back to those schools and say, we're not giving you the funding. You're gonna have to find it somewhere else. And I think the federal government hasn't always been clear on how to use it. So they want to have some wiggle room to say, we approved it, but the federal government's not going to approve it. It's federal funds, so we can't reimburse you, which is why we try to stay in touch and make these contacts in email and hope that we're doing everything that we can. The other thing I might mention, because we're going to talk about it at ESSER anyways, just because they got pre-approved doesn't mean we have enough money to do them. We haven't done the bid process yet. So we have some rough estimates of what each project might cost. But I was just like, throw in the kitchen sink? Like, well, whatever I could think of, I put out there, knowing if I at least could get them pre-approved, and then I can bring things back to the board and we're one step closer.
That brings me to the question that I had. We understand that the state has pre-approved these projects for whatever that pre-approval means at this point. The board has not yet weighed in on these things like the boiler replacement and things like that. I mean, some of these I think are going to be no-brainers if we get the money to do it.
The board told us to move forward with 2. The nurse's office at Mount Webb.
That's right.
Behavioral
That's right. That's right.
We have some diagrams and we have some costs for that.
Right.
Worked on that over the summer.
Right. But these others we're going to have to revisit at some point. Okay.
Yeah, we just,
I just wanted to clarify that.
Yeah, in the spirit of keeping things moving and trying to give you some guidance, we figured, we should ask before we start talking about stuff, before we even go to the state. So you're right, this is not anything the board has approved.
Are you asking for us today to kind of come up with, I know you don't have numbers yet. I was myself like super excited to see the cafeterias possibilities here and the cooking kitchen that MLS and things. So are you, I guess what's the priority? You're going to ask for, you're going to get numbers first. And then we make a priority list, or like, how's that going to go?
I think at the next meeting, if people could give us guidance, there's a lot to digest. We've been living it. So my thinking was with Richard is if we could use this as an introduction, let you know, get the whole board on the same page, because we've talked a lot about finance and facilities, but now we have more answers. And so when you're thinking about the cafeteria at Hanover Street, I'll just say this out loud. In order to do the Hanover Street cafeteria, it means you have to move 3 or more classes, the nurse's office and the surrounding classes, because that's the only space you can push in. And there's not enough ESSER funds to do the Hanover Street cafeteria and all the different renovations that would have to go with that to make it a complete project. I put it in there because I was curious to see if we could get it through, because it was a food related health nutrition, the same thing as Mount Leb, whereas Mount Leb, simply because the way their project is, you can do pieces of it more readily than Hanover Street. Hanover Street's a more complicated building project. That being said, I'm not picking one over another. We've walked through these buildings and we've looked at these plans so many times, and getting costs, doing bids would be helpful, because we're not quite sure where those costs are going to be. So the guidance would be at the next meeting. If you could tell us, here's the projects we want you to spend the money on to do RFQs or look into further, get some detailed plans, we would appreciate it.
And given that we know there's not going to be enough bucks,
right?
Some prioritizing is going to be necessary.
Richard's going to talk about the impact fee. So if I could just jump to the summer projects list. I had asked Dana to put together a list of the projects that he's been working on in the facilities department. And I'm not going to read them line by line, but there's quite a bit of stuff that his team has really accomplished. Some of them, some of them are contract out, like the abatement of the asbestos floor tile. That's stuff you approved in end of year stuff, for example. Actually, I guess a lot of these are projects that he subbed out. The summer cleaning was the responsibility of his custodial staff. And I just want to point out publicly that we have in the budget and have traditionally had in the budget up to 10 positions for high schoolers to work. And in recent years, it's been harder and harder to get them. This year, we only had one that stayed the whole summer, I believe, or maybe 2. In addition to that, we have at least 3 custodians who are off for medical issues or issues like that. So his staff has done a yeoman's job. As you walk around the schools and you see that they're clean, just keep in mind that not only were we short-staffed, but we, three custodians out of like 16. That's 4. And then we didn't have the summer help either. So his staff did a really amazing job and working around a really big, if you went over to Hanover Street this summer, it was busy with all the activities going on. So I just want to say good job to them. A lot of these things, you can see the stuff that's done. So the rooms will be done, the classroom renovations and stuff, they'll be done by next week. So there's a little bit of construction delays that are across the industry. Things like glass being a little late, but I'd wonder if you have any questions about that, or the project's still in progress. You can see them. That's all I have.
Do you want to? Should we? Is there anything else in facilities that you were going to talk about, Tim? I know that that impact fees are there, but do we want to talk about the specifically this Marinette's quotation from Lead School renovations? And, I mean, it would make sense to do that now.
Specifically what? I'm sorry, I couldn't hear you.
Well, we have the Marinette's quote for the nurses suite and special services renovations and the floor plan.
So I met with Paul Marinette's and Margaret Thomas from Marinette's Architects over the summer. We scheduled a meeting to meet and do a walkthrough of Mount Lead School. And you can see some preliminary designs or concepts. I hear Dana in my head say concepts that show what we're thinking of doing. And they also contacted different contractors to give us the estimate of costs for this project. So the first large piece of paper that has the different rectangles in it, that's what the new behavioral or cub care space will look like. We were fortunate that Gino was in the school that day. So Gino was able to walk through these different rooms with us and give us his sense of what would work or what might not work. So you would come into what's currently there are the two classes or the two spaces on the right-hand side. So let me pull up the slide and I can show it to you up on the screen. Just a little slow. It's not used to being at a board meeting. All right. So these two spaces here are already there. We renovated in those years ago. This space that shows a table is now PTOT. So that probably will stay there. It's not a table space, but it could be. This is a new entrance. So the door is the same to the right, flipped another way. And there'll be a hallway. So instead of having one large room that's kind of cut in half by furniture, it'll have two separate spaces to work with students. And then when you come in and you go to the left, there's new storage areas for cabinet, upgrading the sink and updating cabinets along those two walls for storage. And there'll be a window where it says window between to let the light in from the exterior wall through. So that is the behavioral space. And then the next one is very different. So if you've been at Mount Leb, you know that there's the nurse's office and there's the space that they've used this year for the isolation space, kind of has plastic over it. That whole space is going to get blown out. And that door that pushed in that we never used but confuses parents, we're going to get rid of that middle door. It's not a fire code issue or anything like that. So the nurse will finally have space for some students in there, the changing table that can be pulled down. That bathroom is not ADA compliant. So we'll have an ADA compliant space. And currently you walk in and her table is right there. There's no place for privacy or to do paperwork necessarily. So where the door used to be, if you think of it that way, we're going to push the building out, and that will be a space for her desk to be able to make phone calls and things like that. A new sink and counter, the ADA bathroom, and you can see that she'll have some student tables and chairs, space for two cots and table or storage. So it's going to be a much more functional space for our students, our staff, and our nurse. The quote that came with that comes after that page. And so the site work is $5,000, estimating. The general building construction for both the nurses suite and special services renovations is $275. Architect, engineers, and we're going to need an ESSER consultant because it's so confusing how you have to use these ESSER funds. So we're going to need assistance with that to make sure we follow all the Davis-Bacon laws associated with it and some contingency. Then they list some of the things that are not included in the cost. And this is their estimate. And Tim, my understanding is the next step would be to actually bid it out and get the numbers later on this year. Like they mentioned December or January to do that.
Yeah, well, again, these are concepts. And so to develop bid documents and then go to bid. So you can't, nobody can bid off those pictures. So that's the next step.
Questions about this, these plans so far? Okay, thank you. I do have a quick report. I am sensitive to the time. It's 9:25. But we are making progress. I do have a quick report on the some of the activities Joanne and I have been involved with the Lebanon Planning Board over the summer with regard to impact fees. And I'll go through this fairly quickly at a sort of a high level. There's more information, a lot more information available on the Planning Board website, and not the sort of thing you want to jump into unless you're well rested. But just by, oh really? But just by way of background, we get impact fees from developers to mitigate the effect that residential construction has on the district due to increased enrollment. And historically, this is very hard to predict because it must be paid when the certificate of occupancy is issued, but developers can pay this anytime they want. And the current formula for impact fees that the district is entitled to is tied to the construction costs of the building that we're in here, and that is all. Typically, Tim budgets about $10,000 a year in impact fees, which is budgeted for and applied to bond payments on this building. And this year, we got $273,000, and which kind of testifies to the difficulty of predicting this. And so that's kind of what prompted us to look at this a little bit more closely and make sure that these impact fees, A, are doing what they want, what we want them to do for the district, and B, as we go into the future, that we basically have a formula that makes sense to the district. Because our thought was that you're having it just tied to this single building does not necessarily make a whole lot of sense for us. And so this was good timing because the impact fee schedule is currently being updated by the planning board. And Joanne wrote to the board on our behalf requesting the formula be revised in some way to more accurately reflect the impact of residential construction on the entire district. So between March and the end of May, Tim and Dana provided updated data to our planning director, David Brooks, and consultant Bruce Mayberry. They worked with all this data. In July 26th, the planning board met. Joanne and I were present to have an initial discussion based on a report from Mr. Mayberry. And he presented 6 options to the planning board, one of which was the current formula. And this formula is based on the full development cost of this building indexed to 2021 dollars. And that leads to an impact fee right now of $1.09 per square foot for single family detached dwelling. And that report is available on the Lebanon.gov site for anyone who wants to look at it. Just go through to the planning board meetings and the documentation that's there. And again, that's just tied to this building. And the most important option from our perspective that Mr. Mayberry presented was based on the replacement costs for all 4 of our buildings, which he based on the insurance values that are assigned. And when you use that formula, you come up with something called the maximum supportable rate, which is a number that cannot be exceeded, but it's a maximum rate that we can support, that the city could support based on the data that they have. And that leads to a fee of $3.19 per square foot. So that's a substantial increase. That's about a threefold increase roughly. And there was, at that July 26th meeting, there was broad support for the impact fees being allowed to apply to all the district schools. That part was pretty easy, not just Lebanon Middle School. There was concern at the time about the negative impact that changing the fees would have on developers wanting to build in Lebanon. And there was some uncertainty about where Lebanon stands for impact fees compared to other cities and towns in the state. And Mr. Mayberry was asked to go back and get that information and come back. They met again this past Monday with that additional information. And it turns out that Lebanon's impact fees are well below the average for all communities in the state, and even more below the average of the most comparable communities to Lebanon in terms of population and characteristics of the school district. Again, the planning board strongly supported us being able to use impact fees for the benefit of all the schools in the district. There was a debate over going to the maximum supportable rate of $3.19. There was not all that much support for it, again, for fears it would be a disincentive for builders. For a new home, what that means is a new home of 2,000 square feet, priced to sell at $410,000. The total impact fee paid by the builder would rise from about $4,000 to almost $9,000. And that made people kind of nervous. So there was a lot of discussion and a lot of back and forth, straw votes and so forth. What they finally agreed on, at least the majority agreed on, was to set the impact fee at 55% of the maximum supportable rate of that $3.19 or $1.75. So that's more than $1.09. And it's probably the best outcome that I think we could have expected to get. It does mean that if that is approved by the planning board, when Mr. Brooks and Mr. Mayberry come back with an updated draft of this document that includes everything that was decided, if that is approved, it does mean that we will get a larger impact fee for housing that's built in town, and we'll be able to apply it to a broader range of projects. There are some things that we have to do on our own in terms of what we can spend that money on and when we can spend it. And that's a discussion for another day. But I think this is good news. The city is responsive to our needs, and the impact fees we get are going to increase. Again, we have no idea year to year what those are going to be. It depends on what projects are approved and when the developers choose to pay the impact fee that they're assessed. So that was supposed to be a short report. Sorry, I rambled a little bit. Anybody have any questions about that? Okay. Moving on, committee updates. I think I can just read through these because there's no reports. Finance and Facilities will meet next on Thursday, the 2nd of September at 4 p.m. That's a U. Policy meets Tuesday, September 7th at 8:30 a.m. in the SAU office. Education Committee meets Monday, September 20th at 4 p.m. SAU. Personnel and Negotiations are having meetings, dates known only to them, at the SAU office at 4 p.m. Student Wellness Advisory Committee meeting Wednesday, October 6th at 3:15. Hartford area. I'm sorry, the Massachusetts accent comes through when I get tired. The Hartford area Technical Center. Next meeting Tuesday, September 7th at 10 a.m. Area Committee meets next Tuesday, meets on Tuesday, October 26th at 6 p.m. here. And the City School Joint Task Force will meet on October 21st at 6 p.m. again in this building. New business. Mr. New Hampshire School Board Association Delegate Assembly is coming up on October 16th. I believe that's going to be a hybrid meeting. I think it can be attended in person or virtually. We don't have to provide a delegate to that assembly, but we can if we want to. School Board Association is helpful to us, particularly in developing policies and as a resource for legislative actions and so forth. There are a series of resolutions that the Assembly is going to be considering. You've all been getting emails about this. So what I'm looking for, if someone is so inclined to be our delegate to that assembly on October 16th, and between now and then, the board would provide you with some guidance on how we would like you to vote on these various resolutions that are to be considered. Are there any volunteers? Don't all jump at once. Stephen volunteers. Thank you, sir. Anyone else? You want to be the alternate? Okay, Stephen and Lillian is the alternate. We need I think we need a vote on this. The nomination, and I will nominate Stephen as our delegate to the assembly and Lillian as our alternate delegate to the assembly on October 16th. May I have a second? Who was her? Tammy? Okay, second. Any discussion? All in favor?
Do we vote?
Thank you. Yeah, you can vote.
Or you can vote.
You can vote, you can abstain. Okay. It's unanimous with maybe an abstention. Okay, you guys are appointed. Thank you. We had a public hearing at the beginning of this meeting on the donation of $15,000 from the Byrne Foundation for the World Story Exchange at Lebanon Middle School. We now need to accept that donation. May I have a motion for that, please?
I move to accept the donation of $15,000 from the Byrne Foundation for the World Story Exchange at LMS.
Thank you, Lil. Second. Second by MJ. Discussion, comments? Besides our sincere thanks to the Byrne Foundation. All in favor? Unanimous. We need to acknowledge donation of $1,200 from Brian and Lois Warren for Lebanon High School Makerspace. Is there any vote required, or just we just acknowledge that?
Usually Laura writes acknowledge, so it's an acknowledge the donation, correction? Acknowledge.
Right, the board policy, and I think the law is that 5,000 or more you have to approve. Our policy is anything between 500 and 5,000 is accepted by the superintendent, and the board acknowledges and says thank you.
So hearing no objection, the board will acknowledge that. Future agenda items. Any board member recommendations or questions for future agendas? Hearing none. Next school board meeting, Wednesday, September 8th, hopefully in the cafeteria. This meeting was supposed to be in the cafeteria, but here we are. I think this is going to depend on what space the middle school needs, but we're right now we're planning on meeting in the cafeteria. Is there any other business? Joanne, do we have any other business, Tim? No other business. 9:38, may I have a motion to adjourn, please? Motion made by Stephen, second by MJ. All in favor? The meeting is adjourned. Now that we are adjourned, we will have a brief meeting which is exempt from the provisions of RSA 91A2, and we will gather in the room across the hall. This should not take long.